Good morning, everyone. Good morning on this lovely Wednesday morning. Welcome to the Joint Audit and Evaluation Committee. And I'd like to introduce Vicki Gruber from the Department of Legislative Services. Thank you.
Is that on? Great. So yes, thank you very much, Madam Chairman. I just wanted to take a brief moment to introduce you all to Ken Weaver, who many of you may know already. Ken's been with the department almost 10 years. He first started actually as a budget analyst and then most recently has served as staff to the Appropriations Committee. And one of the things that we've observed working with OLA and OPA, our policy branch, is we want to create a better connect between the findings in the audit and your ability to respond to them. And so Ken graciously agreed to take over this role to try and translate and follow through the session what the findings are and how can he assist you in addressing those findings if there's a legislative solution or budget language solution or other means to ensure that the findings don't just sit there, that something is done about them. And so with that, I'll just turn it over to Ken to say a few words.
Yeah, good morning, everyone. Just wanted to say hello, and it's great to be back in my old stomping grounds right here in appropriations. I'm really looking forward to this position, so I just wanted to thank Vicki and thank Brian as well. Brian Tannen's put together an amazing team at OLA. And again, what I'm going to be able to do is hopefully kind of be a midpoint between OPA and DLS and OLA and all of you here in the Joint Audit and Evaluation Committee, so that as we move forward, we'll be able to better integrate audit findings into a kind of a more standardized process as we figure out what the solutions might be, whether it's budget bill language or legislation, whatever it is. I'll be here to help. So thank you very much.
I was just going to say, Ken, we're going to miss you on appropriations, but really excited to have you in this new role. And thank you, Vicki.
Thank you.
So I think with that, we're going to turn it over to Brian and his team.
Good morning. For the record, I am Brian Tannen, your legislative auditor. With me on my left are Eddie Rubenstein, who should look familiar to you, not just because he presented two of the most recent reports that we had, but because in 2021 he sat in this very position talking about SSA. In addition to his left, we have Nate Suffin, who is a senior auditor. I'd be remiss, I keep telling you, it takes an army to go and do an audit, and so I'd like to introduce other members of the team, some of which are in the audience today, others couldn't make it into the room. Starting with Bakana Dosa, I introduced Nate. With me on my right is Johanna Bachman, Jamie Brown, Zoe Smith, Brian Rebert, and our DAU team who compiled a lot of the data that were used and are included in the report. I do have a number of new employees that I was going to introduce. They're not in the room at this time, so I'm going to pause. I may bring them back later to introduce them. Once again, good morning. Brian Tannen. I'm here to talk about our September 2025 audit report of the Department of Human Services Social Services Administration. The report had 14 findings, including repeats of 6 of the 8 prior findings in our 2021 report. I got to tell you, I think if I was SSA, I think we should be good friends because we have had more correspondence and interactions with the department since 2021 than we have with any other single agency. We've had 2 hearings, including, I just mentioned, an April 2021 Joint Audit Committee hearing and a presentation to the House Appropriations Committee. We've had 2 JCR reviews, 4 quarterly status reports, 1 JEC letter of concern, and about $600 million plus spent on an MD Think system to try to go and resolve the system, and we're still here today. And they have the distinction of being a 3rd unsatisfactory audit report in a row. That has, at least in recent history, in my 30 years, we have never had an agency go 3 audits in a row with an unsatisfactory. By comparison, since 2000, calendar year 2021 was number 8. We've had 8 unsatisfactory reports since calendar year 2021. 2 of those are SSA, the first one in 2021, and now again in 2025. I think it's important. A lot of the findings that we're going to be talking about today are going to be talking about activities at the local departments of social services, and if I turned around, I would see many of the heads of those departments here. This audit is not about the local departments of social services. This audit is about the Department of Social Services Administration. And I think we need to draw the distinction between those two. We did not go out to the local departments. We did not look at some of the incredible work that they do every single day under some very challenging circumstances. We are looking at the way their activities are being managed. And those activities and the findings in this report cannot be solved by any single one of those local departments of social services. It requires someone much higher up to go and affect change. And I think it's important to realize this is not the only report that deals with the challenges of coordinating that effort. Our 2022 FIA report also includes a lot of findings that deal with the local departments of social services. That report had 10 findings, including 5 repeats. More importantly, the department's own OIG goes out and routinely audits the local departments of social services. They've identified their over the most recent year. We issued a report in April 2025. They had 221 findings, including 70 repeats. Those are their findings, not mine. The ability to go and resolve those systemically across these local departments needs some significant coordination. And I think one of the challenges that I have is the timeliness that we respond to this. We issued our report in September 2025, and there's been a lot of attention to that report, in particular to the children living in the hotel rooms and the tragedy that happened subsequent to the issuance of our report. We did not tell anyone anything new. I'm holding in front of me an article that was published by the Baltimore Sun in October 2024. The headline was, "Housing Maryland Foster Children in Hotels, Unsafe Situations for Everyone." It's nothing new. The challenge that we need to address today, hopefully at this hearing, is how can we affect change in a timely manner, in particular when we're dealing with situations that impact the most vulnerable people of our society. And with that, I'll turn it over, Eddie, to walk through the findings in our report.
Good morning. For the record, once again, my name is Eddie Rubenstein, and I was the OLA director responsible for our audit of the SSA. Slides 2 and 3 give an overview of our report and the key findings, and I'll start with the first finding on slide 4. The independent LDSSs are responsible for administering the foster care, adoption, guardianship, and child protective services programs. SSA is responsible for ensuring that the LDSSs perform these functions in accordance with state laws, regulations, and policies. Our audit disclosed that SSA has still not established a comprehensive and effective quality assurance program to ensure the LDSSs properly administered these programs. As I'll explain in the next several findings, the lack of oversight resulted in numerous issues impacting the safety and well-being of children participating in SSA programs. Next finding on slide 5, SSA did not have comprehensive procedures to ensure individuals with criminal backgrounds did not interact with children in its care. State laws and regulations require individuals with unsupervised access to children to have criminal background checks and specify crimes that disqualify them from providing services. We found the SSA did not ensure that adults convicted of these crimes were not residing at homes approved for the guardianship program. The LDSSs obtained criminal background checks for all adults in a home at the time the home is approved for the program. However, SSA did not conduct periodic follow-up to identify any new adults living in the home. As I'll talk about in the next finding, we identified 7 individuals on the Maryland Sex Offender Registry whose address was associated with a guardianship home. SSA also did not ensure that criminal background checks were obtained for vendors who provided one-on-one services to foster children. During fiscal years 23 and 24, SSA used 14 vendors to provide care to children in hotels. We identified 1 vendor employee who was convicted of murder in 1990. At the time of our audit, SSA could not readily determine whether the individual had unsupervised access to children. SSA also did not ensure that background checks were performed for individuals working or residing at locations housing foster children. SSA relied on DHS's Office of Licensing and Monitoring to ensure that criminal background checks were completed for all group home employees. OLM's review of a group home in April 2023 did not identify that one individual had been convicted of sexual assault of a minor in 2014 and was listed on the sex offender registry. In June 2023, this individual allegedly transported 3 kids for activity, which a Washington County LDSS investigation concluded there was evidence of abuse. SSA could not document any corrective actions it took to ensure that criminal background checks were obtained at these facilities. On a similar note, finding 3 on slide 6 is that SSA did not have a process to periodically reconcile the sex offender registry to its records of providers and vendors to identify any sex offenders with potential access to children. As I said a moment ago, we matched the registry to SSA's records. We identified 7 people with the same address as an approved guardianship home. There were 10 children placed at these homes as of August 2024. For example, one individual convicted of sexual misconduct involving a minor had the same address as a home with 4 children between the ages of 4 and 8 years old. SSA's response to our report indicated that it does not believe it has the authority or responsibility to continue monitoring children once they're placed in a guardianship home. However, I would point out that Section 5-551 of the Family Law article includes a provision requiring any adult known by the local department to be residing in a guardianship home to obtain a criminal background check if the local department requests one. Finding 4 on slide 7, which is that SSA did not ensure that data recorded in CJAMs, which is used to monitor the LDSSs, was accurate and supported. Although SSA periodically attempted to verify the data, it did not ensure that missing or inaccurate documentation was corrected. For example, one SSA review performed in December 2023 determined that there was no support that initial health exams were performed for 59 children. SSA could not document any efforts to correct this deficiency, and when we looked at it in September 2024, or looked at 10 of the children in September of 24, we found that CJAMS was still inaccurately reflecting an exam was performed for 8 of them. Finding 5 is on slide 8. SSA did not ensure the LDSSs provided foster care children with required medical and dental exams. As shown in the table on the slide, as of May 24, numerous children had not received the required exams. For example, the 1,600 children who had not received a dental exam within the last 6 months includes 140 children who had never received an exam, and another 278 children whose most recent exam was up to 7 years ago. Finding 6 on slide 9, SSA did not ensure that LDSSs placed foster care children in settings authorized by state law. We identified 280 foster kids who were placed in hotels between fiscal 23 and 24, some for as long as 2 years. Although SSA advised that many of these children had special behavioral or medical needs that required specialized placement, SSA could not document efforts to identify an appropriate placement. The cost associated with these kids totaled $10.4 million, which primarily related to payments made to one-on-one vendors that supervise the children. Since one-on-one vendors are not licensed providers, SSA lacked assurance that the children received an appropriate level of service, and as previously mentioned, these vendors were not subject to background checks. Finding 7 on slide 10, SSA did not ensure the LDSSs established and maintained required trust accounts for children. State law requires a portion of federal benefits received by children 14 and older to be conserved in a trust account and then transferred to the child after they exit the state's care. Our test of 10 children disclosed that a trust account was not established for one child, resulting in $20,000 not being conserved. In addition, 2 children's accounts were underfunded by $13,500. Issues with these trust accounts are also routinely noted when DHS audits the local departments. Finding 8 on slide 11, SSA did not investigate and recover overpayments to public foster care providers, guardians, and adoption subsidy recipients. Overpayments can occur for multiple reasons, including payments made to a provider after the child is no longer in their care. Although SSA generated a CJAMS report of potential overpayments, it did not investigate transactions on this report to determine if the funds should be or had been recovered. According to the CJAMS report, potential overpayments in fiscal years 20 through 24 totaled $34.5 million. Finding 9 on slide 12, SSA did not meet federal foster care performance requirements, resulting in the state incurring penalties of $698,000. The federal government conducts periodic reviews known as CFSRs to assess the state's foster care performance outcomes. Maryland's most recent CFSR was conducted in April 2019 and determined the SSA was not in compliance with 7 performance outcomes. SSA was found to still be non-compliant with 1 performance measure in September 2024, resulting in the penalty. I'll now turn it over to Nate to discuss the remaining findings in the report.
Good morning. For the record, my name is Nate Suffin, and I was the senior auditor on the SSA audit. Continuing with finding 10 on slide 13, SSA did not sufficiently address LDSS lack of compliance related to timely child abuse and neglect investigations. State law requires investigations be initiated within 24 hours for allegations of abuse and 5 days for allegations of neglect. The law also requires that investigations be completed within 60 days. Although SSA established procedures to monitor LDSS compliance with the timeframes, it did not take effective corrective action to address areas of noncompliance. According to SSA records, between January 2023 and June 2024, 22 LDSSs did not meet compliance standards for timely initiating investigations in at least 1 month, including 5 LDSSs that were not compliant for all 18 months. In addition, 2 LDSSs were not compliant in completing investigations timely. Although SSA required non-compliant LDSSs to provide corrective action plans, we determined that these plans were not comprehensive, and SSA did not take action to address the plans. For example, one plan cited inadequate staffing levels as the primary reason for the untimely investigations, but did not identify the number of staff needed to reach compliance, and SSA could not document any specific actions it took to address the staffing issues. In addition, SSA did not refer LDSSs with long-standing noncompliance to the DHS Secretary for further action as required by its policy. Finding 11 on slide 14 noted that SSA did not report child abuse and neglect investigations that were not completed within 60 days to the General Assembly. State law requires SSA to submit quarterly reports to the General Assembly listing investigations that are not initiated or completed within the statutorily required timeframes. While SSA reported investigations that were initiated late, it did not report investigations that were completed past the 60-day window. According to SSA records, during fiscal year 2024, there were 2,719 investigations that were not completed timely. Finding 12 on slide 15 noted that SSA did not have an effective process for ensuring the propriety and timeliness of Title IV-E eligibility determinations. For children that were determined to be Title IV-E eligible, the state is generally allowed to claim federal reimbursement of 50% of the cost for their services. As of June 2024, SSA had not determined the eligibility status of 2,100 children who entered care dating back to May 2020. As a result, SSA did not obtain federal reimbursement for the cost of the services provided to these children, which potentially totaled $22.5 million. SSA primarily attributed the cause for this issue to CJAM's limitations, but did not take alternative action to enable the recovery of federal funds and could not provide an estimate for when the CJAM's issues would be resolved. SSA also did not always properly and timely determine the Title IV-E eligibility. Our test of determinations of 45 children noted that 6 children were improperly determined to be ineligible because information was incorrectly entered into CJAMs or available information was not obtained. As a result, SSA did not obtain federal reimbursements totaling $475,000. In addition, the initial eligibility determination for 22 of these children were completed 115 days to 3.5 years after the child entered care. State regulations requires these determinations to be completed within 60 days of when the child is removed from their home. Finding 13 on slide 16 noted that SSA did not establish procedures to ensure federal reimbursements were claimed for all eligible qualified residential treatment placements and evidence-based practice expenditures. Our test of federally funded payments for these programs totaled $3.15 million disclosed that SSA had not requested federal reimbursement for $3 million of these expenditures, including $2.6 million that SSA advised is no longer recoverable. Finding 14 on slide 17 noted that SSA did not ensure that certain payments made to a state university were adequately supported. SSA had 3 interagency agreements which were primarily based on the actual time spent and the salary costs of the applicable university employee. We found that SSA did not obtain documentation to support the propriety of these charges and the reasonableness in relation to the tasks performed. Similar findings related to these agreements have been commented upon in our 5 preceding audit reports dating back to October 2008. Our conclusions are on slide 18, and we are happy to answer any questions from the committee.
Thank you very much. Thank you, Mr. Tannen and team. Are there any questions of the committee? Delegate Ahrens.
Thank you. Appreciate it. Appreciate you being here. There's a lot to this audit, and it kind of reeks with a little bit of what we heard in the last audit. But as I read through this, I'm looking at the findings. Are there you're indicating a lot of things in here about no procedures, no procedures, no procedures. Does that mean that there are none existing in the department, or are they just ignoring them?
I think it's a little bit of both. We have the Child Protective Services finding where there are some procedures that they have in place, but they're not adhering to them. They identify local departments that are not in compliance, and then they, for whatever reason, don't take any additional action. Okay. But then there are also ones where the procedures just don't exist to identify the issues that we're noting.
We hear time after time in these audits that we have to write a procedure for this. This department's been around quite a long time. And this audit, I guess, when did this audit exactly start? Was it from 2022? Or
The audit period that we covered was from May 2020 through 2024. But to your point, 6 of the findings included in the report, or 6 of the 8 are repeats from at least 1 or more prior audit reports. So it's not, the recommendations are not new to the department.
Okay. And I noticed in the response, and we'll get into the department after this, a lot of the responses are starting from 2024. I've noticed, throughout there's a theme that everything started after your audit was finished. And we're finding that these things are still continuing. And that's disconcerting, because it's great to get an audit and read it, and then all of a sudden you're addressing it. But these problems have been ongoing. And I would expect that if I came into a department and I saw repeat findings, that would probably be the first place I would go. Is that an assumption I should make or not?
Again, I think I would agree with you that some of these should have been addressed before we got there. And the status reports that we were provided during the interim at certain points showed progress towards those goals, and our most recent one showed that from the department's perspective, they had implemented all of the recommendations. Our review, though, found that that was not the case. We did not think, while there may have been some progress, we found that they had not satisfactorily addressed those, and subsequently during this audit, we found that that was the case when we actually did the work. I think you could look at it 2 ways. Let's talk about the period just since we issued this audit report and some of the things that have come out from the department, which I'm sure they'll present, in particular related to the hotels, the initiatives that have taken place just in the past month. The question I think that you're asking is, why did it have to happen after an audit report? And why shouldn't this have happened in 2024, a week after this article came out? Why couldn't we have had the same thing? So there seems to be an ability to, at least some ability, when a focus is put on something, to go and attack it. And if they're going to wait for our audits to come in once every 3 to 4 years, it's not an effective way to make sure that the procedures are implemented and stay fixed.
You had finding 11 about reporting. That reporting part of it, is that the secretary's responsibility, or is that somebody that works for the secretary? Is he responsible for presenting, or are they responsible for presenting that to the General Assembly?
I'm not sure the exact wording of the law. We could get back to you.
Okay. I guess, again, throughout these audits, I'm reading these things and I'm listening to how they're being generated. How many people have work in the department? How many, do you have a number on that by any chance?
I think we have it in the background. At S8, if you want to know the statistics for each of the local departments of social services, the department would have to give you that answer. But based on the budget book, they had 114 positions filled as of June 30th, 2024.
So we've not had a massive exodus or entrance of people coming in.
They did have a vacancy, they did have 27 vacant positions. They could better speak to what the turnover has been. We're quoting a static number. They could better provide some of the statistics of the change during the audit period.
Last question. On the reimbursements that we're talking about, these things are missing. That's not something new. That has been something that's been part of the department since its inception, that we could do that. There are pieces that I understand maybe we're missing and we had to recodify. But these things have been going on for quite a while, where there are procedures that are in effect and they're just not being adhered to. Is that correct?
Correct.
Okay. All right. Thank you, Mr. Chairman.
Senator Lamb?
Yeah, thank you, Madam Chair. So we have, a lot of these are repeat audit findings that have occurred, through multiple different reports. I think what we anticipate we may hear from the department coming up is that, some of this data has been collected, that they've done this work, that these activities have taken place, but you're not seeing any indication of that in their system, right? And so this goes back to what we've said before in prior audits, that, if you can't find any documentation, it, with all, in many respects, potentially did not happen, right? And so is that what you're contending here? Because you could not find documentation for a lot of these, core activities and functions in addition to medical and dental exams?
I think it's really both. There are instances where an event is recorded, such as a medical exam, as having happened in the system, but there's no documentation underlying it. But even if you assume that all the data in there reflects something that actually happened, they're still not meeting the standard.
More importantly, we spent a lot of money, and if you go back and you want to, it's recorded, these hearings, way back when it was Chesy, we talked about this vision of this new computer systems that's going to come, and it's going to give us a lot of capabilities to better and more effectively monitor the activities that are in the report. So they come out with a CGEMS. CGEMS has the ability to have the documentation that Eddie's talking about. When we go out there, we're looking for documentation that they're saying is supposed to be in the system for us to be able to do that. More importantly, it's supposed to be the system that they're using to make sure that these services are being provided. If we can't see it, it means SSA can't see it. And if we have to go out to each of the 24 local departments to find it, then that's not an effective monitoring tool to make sure that the corrective action is being taken.
So if you can't see it, SSA can't see it, which means in all likelihood they're not monitoring it.
I think that's what the report finding is saying, that they're not effectively monitoring to make sure that these things are being done.
Right. So your contention also would be that, they have their own IG, they have their own audit folks. They could go in and do the work that you would ordinarily be doing only every couple of years coming into the department, right? That good governance and accountability would, in some ways, demand that the department take it upon themselves to follow these metrics to make sure that these activities are being done and not have to rely on you, who are probably the folks of last resort, to have to come in at the very end, only every couple of years, to unearth this and then still find that there are repeat audit findings.
As I mentioned in my opening remarks, not only could they do. Our local department operations report is not being heard today at this hearing, but if you open it up, there are not a lot of findings about the quality of their office's work. That's not what the report is about. It really does summarize their efforts. They are going out there, and they are finding problems across the board at each of the locals. It's that next step. And what needs to be addressed from a centralized SSA perspective is it's great to identify problems. That's how I make my living. Fixing the problem requires people who are specialized and focused in the areas that we're identifying. And that's where we're running into the problem. And I keep saying, they don't need more audits. We're auditing it, the information, there's nothing changing. If you go back and look at this audit compared to the last one, the question is, how can we put in place change that will address them and correct them, both from the department's perspective, looking at the local departments, whether it be staffing, whether it be supplementing those staffing, additional technology. But they've spent an enormous amount of money. The computer system, MD think that we've paid, my last record was over $600 million, was supposed to try to address some of these problems. And so to come back and say there may be records that is offline, well, we spent a lot of money for a computer system that's supposed to bring it online. And so that's what I'm saying. I think we don't need to identify more problems. We need to start addressing the problems that have been identified.
So your contention is that the central SSA office is not taking the next step beyond just identifying, but actually trying to work with the LDSSs to address these problems?
Every one of the findings in this report start off with the words SSA did not. It doesn't say the Baltimore City Local Department of Social Services did not. It's focused on SSA, and that's the focus of our findings.
Okay, thank you.
Delegate Lehman.
Thank you, Madam Chair, and thank you, Chair Hedelman and Chair Solomon, and thank you to our auditors. It's a lot of information to absorb and a lot to be really alarmed about. I have two questions. One, generally on the overpayment issue, and then the failure to seek reimbursement from the federal government. Are these IT issues? Are they human error, a combination? What can you say? What else can you say about those issues?
Sorry, the first finding was the overpayments, and the second was which one?
I said, but I'm not citing in specific. I couldn't find the overpayment. There's references, at least one or more, to overpayment situations, then also failure to get reimbursed by the federal government.
Yeah. So I think it's probably a mix of both. The department cited system issues as the reason for, in some cases, why they couldn't do an eligibility determination to enable reimbursement. But in a lot of cases, it's a manual process where someone has to go and either make a decision or obtain documentation to allow us to get the federal money.
So, and we're seeing the outline of your findings. Do your audits go into greater detail about how these issues can be corrected? Especially when, like with the federal reimbursement, we have this specific window, and if someone realizes, in this case, auditors realize it's too late, you missed that opportunity, then we never get that money back. So are there additional, insights or recommendations in your findings that we're not seeing here?
So the report has recommendations, but you are correct. We come in after the period's over. And so we made the same recommendations, and they need to go and figure out the effective way to manage their resources. It's very much the same as findings that we've had at other agencies, where we find something and 3 years later, it's still not fixed. We don't dictate how they go about doing it. Some of these, it's challenging. It does require a mixture of technology, resources, and having the proper people and procedures in place to make sure that things are being done, and someone's monitoring to make sure that it's being done. And I think the department would be in a better position to talk about the specific steps that they need to take to address the findings.
Okay, thank you. And then the second question is about slide 17 and the reference to, it sounds like one state university and a question of payments and whether they were appropriate. What university are we talking about? Is there a reason why you didn't name the university? It's a public university.
It is. So we're very cautious when we're doing these reports because we're auditing the department and we're viewing them no different. And this is how we believe the department should view the university, as a vendor. Our reports don't identify the names of specific vendors because we don't go out to the vendors to try to obtain the support from them. The department's paying the bill. They should be making sure, whether it be a university or a private corporation, that the amount that we're paying is supported and legitimate and we're getting the services that we're paying for. If we were to put it in there, if we were to put the names in there, we would then have to go out to the, just to be fair, we would have to go out to that university and have a dialogue with them and it becomes a little bit more challenging. So our routine procedure is not to identify those other entities in the reports.
But under what scenario would you have a direct communication, in this case with, say, this university? Or do you just not do that?
We audit all the universities. And sometimes, when we're auditing an agency, we will sometimes ask the agency on our behalf, and you'll see that in some of the findings, where in response to our inquiries, the department was able to go get support for some of the items that we tested, and we'll include those conclusions. We do audit the agencies that, the specific university, we audit all the universities. So we may or may not look at this finding from that perspective on the other end when we're doing those universities. The department is welcome to come to the table and share the specifics with that. I'm just explaining why it's not in the report, and because of our statute, I can't disclose anything that's not laid out in the report itself in a public setting.
Okay, I find that a little bit baffling, but thank you for the explanation.
Thank you, Delegate Lehman. And Brian, I did have a question, and I just wanted to also offer my thanks. I think of a lot of the audit reports that we've seen this year, and in my tenure on the committee, I think this is one of the most important ones that we've handled. Just such an unbelievably critical issue when we're talking about the safety and well-being of, frankly, probably the most vulnerable members of our society. And so just want to thank your team again for the work that you've done. I wanted to dig in a little bit more on the roles and responsibilities piece, because I think that's something we'll have a longer conversation with the department when they're here, and I appreciated your comments, and I know many of us have been having these conversations since the audit came out. So in one of the responses to the findings, I think it was finding 4, the agency said, we are reinforcing and clarifying the distinct roles and responsibilities of SSA and the locals, essentially, in ensuring data accuracy. And it sort of breaks it out as like, we expect the locals to be doing this, and almost sort of says something around SSA being a little bit separate. And I wanted you to clarify how exactly are the local relationships to SSA? You touched on it a little bit, but I want to just clarify and dig into that. Are these state employees? Are these local county employees? What's the hiring, firing roles for the local heads?
The department's going to have to address the specifics about the hiring and the firing. I do know that for the vast majority of the local departments, their employees are state employees. Some of them supplement with local employees. There are, I think, 1 or 2 that don't follow that model and maybe our local employees run. Again, the department could provide those specifics. I think we need to take it back, instead of focusing on what the role is, the responsibility for the activity in the report is the department's. If they delegate this responsibility to a local department, it's still their responsibility. So if every single local department decides they're not going to do what they're supposed to be doing, the responsibility comes back to SSA, one place. And that's the way it's written. It's their responsibility to make sure foster care kids are being taken care of. They regulate a lot of the things that are in here. Is there room to, provide some legislation or regulatory clarity to make sure that there's no ambiguity? I'll take the last one, reporting to the General Assembly on untimely child abuse investigations. The law says only report the ones that were not started timely. Well, clearly the intent, or my belief is, the legislature is concerned that these investigations be done timely. Whether if they were started and not completed for 2 years, the legislature still wants to know, because that's the end result that we're looking for. So there's probably room in between to fill in some of the gaps, in particular related to their response to the guardianship homes. We certify the guardianship home, we take the children, we place them there. As Eddie quoted from the statute, we have a responsibility to make sure that we're putting the children in a home that is safe. Not on the one day that we walk them across the threshold, but they are being placed in an environment. And that's where the department, not an individual local Department of Social Services, needs to look at that and say, if it was my child, what would I want before I put them in this home? And I really, that's where the frustration. I was telling my audit crew earlier today, during Sandy, my child was in New Jersey, and we got a phone call that said they lost the power, they were flooded, and they put him in a homeless shelter without power. I had been up the night before dealing with Sandy issues. I walked downstairs, got a cup of coffee that my wife had prepared, and I walked out the door. I didn't say, hey, maybe I should get together with some neighbors and talk about what we should do to resolve this issue over the course of the next 6 to 8 months to 8 years. No, it was my child. I was concerned about his well-being. It happened immediately. And I think that's what some of the frustrations are when you're seeing some of the things in the report again and again. It's not something that we could look at like, oh, we're having this issue controlling our equipment at an agency. It needs a much more pointed and timely response to address these conditions. And that can't come holistically across, because the findings in the report are not about one local department. The statistics that you're seeing for, untimeliness or medical, dental visits not being performed, they may have some with more than the others, but they're across the spectrum. Almost every one of the local departments are included in those statistics. So if that's the case, you can't look at one. You need to look at the person responsible for them all, and that's why it's included in this report.
Just the last question, and I'm going to pose this to the department as well. Did you find anything, you sort of touched on this previously, in statute that we need to address, or do you feel like currently, as written, SSA has all of the authority they need to enforce and create a system of practice across the board with locals? I sort of liken it to, State Highway Administration has multiple divisions, Division 3, District 3 covers Montgomery County, right? I know that if I pick up the phone and I call the secretary and I call the SHA administrator, there is a reporting chain that holds those districts accountable, that I know that somebody is gonna get back to the District 3 folks and we'll get what we need in Montgomery County or in Prince George's. And it seems like there's a little bit of, well, these are local folks and we're trying to bring them on board. Did you find anything in statute, or do you have any recommendations for us as the General Assembly that we need to redefine the relationship or make it clear that that authority doesn't exist already?
So I think as a whole, I would say I think the overall structure is fine and they have the statutory authority that they need. Is there room for some improvement? That's why Vicki introduced Ken Weaver to identify those things and perhaps make some recommendations to the committee. I think if you look at their response, and I think you do have to look at that, there's 14 findings, a lot of repeat. It's unsatisfactory, but there's not a lot of disagreement. And for the most part, they're saying, we're working on this, and they put in some efforts. There are a few, and I'll talk about the guardianship homes, where they said, hey, the current statute says we're only responsible up to the point where the child crosses over the threshold. And that's where we may be able to go and add some statute to clarify what the expectation is from the legislature on how to handle those children. But the vast majority of the findings in here, there's already requirements. Their governance already allows them to go and address the process. Remember, it's their responsibility that's been delegated to the local departments. And so they can control who does what, allocate resources as they feel necessary. But I think they could probably provide some more insight when they come to the table.
Okay, thank you.
If I may, I want to go back to the question about the university. I apologize. I could get you that name offline. I just can't share it because it's not in the report at the hearing. Sorry.
Brian, thank you again to you and your team. Any last questions from the committee? Thank you. All right, I think we're going to call up Secretary Lopez and allow him to introduce and bring up his team from his departments.
Good morning, Chairs Hedelman and Solomon and members of the Joint Audit Committee. I am Rafael Lopez, and I serve as the Secretary of the Department of Human Services. Joining me at the table to my far right is Heather Zanoni, the Assistant Secretary for Data and Policy, Carnitra White, the Principal Deputy Secretary. To my left, Webster Yee, Chief of Staff, Dr. Alger Studstill Jr., the Executive Director of the Social Services Administration, and Robin Harvey, who is the Executive Director of the Office of Licensing and Monitoring. And collectively, we thought being able to answer more granular questions that you might have, the individuals at this table collectively can have a much stronger response to your questions. I'd also like to take the time to thank the auditors. In most instances, people might not welcome the critique that they have talked about, but I, as Secretary, do welcome that, because as they have pointed out, and we have seen that these items have been longstanding, and we want to talk a little bit about how we are trying to course correct and transform a department. Members of our statewide leadership team are also present, joining us in the audience, including statewide leaders and department directors for all local departments of social services, with leaders representing all of the jurisdictions in Maryland. For those working to ensure the safety and well-being of Maryland's children, there's little disagreement about the extent of the challenges we face and what's at stake. It is unacceptable that any child spends even one night without the warmth and love that only a family provides. It is unacceptable when individuals who act as our children's caregivers do not have full background checks. System defects should not be barriers to delivering the highest standard of service and excellence. These barriers have been allowed to persist over the course of decades, and Marylanders deserve better. As Secretary, resolving these challenges are my responsibility in partnership with the department leaders who are here today. Together, we have moved with urgency to challenge the status quo, implementing systemic fixes both before and after the audit. Are these perfect? They are not. Are they done? Absolutely not. But we are moving with urgency to try to resolve these. Together, we are improving and modernizing Maryland's child welfare system, which requires far more than small tweaks. What the 3,762 children in our collective care deserve is the full transformation of our child welfare system, where all children are safe from abuse and neglect, thriving in permanent homes, and surrounded by loving families. That's our vision for the future. And we're here today on behalf of over 6,000 team members across the state to discuss how we can build on the findings from this audit and work together as our partners with the General Assembly to deliver on that vision. Transformation starts with being honest and discussing these challenges openly. And the audit findings are largely consistent with what we found when we took office in 2023. We are not focused on blame, but on setting expectations for transformation. And as we began our work in early 2023, we found, first of all, staffing instability. Job vacancy rates in the SSA nearly doubled between November 2020 and November 2023, and SSA had 3 different executive directors in 3 years. We encountered fragmented oversight. The department effectively functioned as 24 separate departments and a merely centralized SSA, not always coordinating their work together. Many of them having separate processes and separate standards, and we knew we had to course correct this. We encountered IT disruptions, already been alluded to by several members. The multi-year transition to the Child, Juvenile, and Adult Management System, or CJAMS, from the legacy system, which was called MD-CHESI, resulted in inconsistent or incomplete information that we are still struggling with. We also encountered lack of provider engagement. There was no set meeting times or cadence or consistent oversight, and rate reform had been stalled for at least 2 decades in Maryland with our critical out-of-home provider community. From day one, we rolled up our sleeves and worked on every single one of these systemic issues because we are determined to leave Maryland better off long after we're gone. We're also committed to transforming the department. Let's be clear. We largely agree with the audit's findings, and no matter where and how the problem started, we own our responsibility to deliver solutions. And we'll partner with you to lead this transformation because that's what Marylanders deserve. The safety and well-being of Maryland's children have been our highest priorities. We have been working urgently in 3 particular areas that we want to highlight for you: investing in our people, in practice, and in policy. First, investing in our people. Transformation begins with supporting and empowering our entire child welfare community to do what they love, which is to help Maryland's young people thrive. We invested in standardizing operating procedures across the state and training caseworkers to provide more consistent service. Again, is this done? It is not, but it's a step in the right direction. Importantly, when we invested in our teams and set the direction that family matters, we began seeing real progress. Caseworker vacancy rates cut by more than half since November 2022. Supervisor turnover reduced by 10% over the last year alone. And the average experience level of our team has increased by nearly 2 years since 2022. We partnered with the legislature, finally passed rate reform, and modernized the law for the first time, we believe, in nearly 3 decades to prioritize kin placements, leading to a 30% increase in out-of-home youth living with family by blood or by choice over the last year. We are far from done, but these are important markers of a long-term turnaround. You've already spoken to the questions of standardizing practices and accountability. We're on a path to do just that. In a critical first step to take accountability and change culture, we overhauled the leadership team at the Social Services Administration. We began to set a new standard of unity across our agency, I literally coined hashtag Team DHS, literally week 1, to behave as a singular agency and to stop the fragmentation across the state. We held regular meetings with our local department leaders and invested the time to meet our local teams where they were and to build a culture of moving together as one agency, one statewide DHS. Our Audit, Compliance, and Quality Improvement, or ACQI unit, was created in 2021 in response to the previous audit findings that were alluded to by the auditing team. However, it was fraught with staffing turnover and data quality issues. We didn't shy away from those. We were trying to tackle those every single day. We moved quickly to address data quality and empowered this team to maintain rigorous oversight of local departments through weekly monitoring, monthly notification, good cause exemptions, and quarterly quality assurance, or QA reviews. To ensure ACQI oversight results in continuous improvement, we proactively engage local departments to review state and federal compliance metrics, audit findings, and make needed changes. Our practice changes are helping us move as one team to the extent allowable under Maryland law, as identified by the legislative auditors. We are also focusing on improving data integrity and transparency. Since taking office in 2023, we have regularly discovered deeply embedded and flawed data management and governance practices. Previously, key data, including hotel stays and hospital overstays, were either not tracked or were tracked manually on spreadsheets in multiple ways across the state. Unfortunately, we continue to discover legacy practices, including fragmented data reporting approaches and manual or outdated processes that are not consistent with modern best practices. Using existing budgetary allocations, we created a data office to modernize data analysis, management, and governance moving forward. We're also working to implement policies that close loopholes and protect children. As we work to address the specific challenges identified in the audit, we are also focused on continuous learning and taking action to provide the level of service that Marylanders deserve, no matter where or how these issues came to light. We want to address 3 particular policy areas today, and of course, we'll be happy to take more of your questions. First, on the issue of standardizing background checks. It is absolutely unacceptable when children's caregivers do not have full background checks. When problems in this area first came to our attention, we acted immediately to protect youth from potential harm. Then we turned to the systemic underlying issues, breaking down silos, including new guidance to our providers, and implementing new monitoring tools to protect youth in a variety of placements. We acted immediately to improve background checks, and our Office of Licensing and Monitoring, or OLM, reviewed 100% of DHS licensed private providers from February 2024 to September 2024. This included criminal history, CPS history, and residential child and youth care, or RCYCP certification. OLM completes the same reviews for new staff, foster parents, or household members who turn 18 prior to recertification. One-on-one providers have historically in the state of Maryland been managed very differently, independently across the state at the local level. And to ensure consistency and accountability, we have standardized statewide contracts for one-on-one providers covering all 24 jurisdictions in the works and requiring criminal background checks for all individuals interacting with children in our care. Provider contracts for Baltimore City and Anne Arundel County were approved by the Board of Public Works on September 10th of this year, something that we've been working on for a while. The remaining contracts will be approved when they're presented to the Board of Public Works at the end of this year, early January. That will be a first for Maryland. This has not been done before. We ensured background checks are conducted on all individuals seeking to become legal guardians before a court's decision. And we are planning to add new notifications to the Guardianship Assistance Agreement to include searches of the Maryland and National Sex Offender Registries. However, the audit doesn't acknowledge our legal limitations once a child in need of assistance case is closed and a legal guardianship is established by the courts, which as of right now ends DHS care and custody of that child. We are happy to partner with the General Assembly to determine the proper authority and happy to have those conversations beginning today and moving forward and figuring out new proactive solutions. On the matter of ending hotel stays, we have worked since day one to remove structural barriers and end once and for all the practice of youth in our care who experience hotel stays in other unlicensed settings. Importantly, you cannot change what you don't measure. And early in January 2023, we asked some simple questions of SSA and our locals departments. We asked SSA specifically to begin tracking youth in hotels statewide so we can better get a handle of this and understand the data to drive and be data informed and heart-led in our actions. In February of this year, we issued a policy establishing statewide standards for reporting and documenting in CJAMs, not on spreadsheets, not on paper, any youth in care experiencing a hotel stay. And we convene a rapid response meeting within 48 hours of the placement of any youth who has to experience a hotel stay. Even as we work to eliminate the placement of youth in hotels, we must acknowledge the challenges created when placement providers refuse to admit or eject a youth, or when a child's attorney might recommend a hotel. We have made important progress here. On January 31st of 2023, there were 41 youth in hotels. And as of this morning, when we ran the data and confirmed it with our local departments, there are 5 youth in hotels. Building on this progress, we directed local departments of social services on October 22nd to stop facilitating hotel stays. And to move any remaining youth to appropriate care no later than November 24th, 2025. Excuse me. On the matter of providing timely medical and dental checks. Providing these timely and thorough health and dental care for children, these checks for children in our care is not only state law, it is the most basic expectation we have in caring for our children. And in state fiscal year 2024, 93% of children had their initial health screenings completed within the mandated 5 business days, and 89% had comprehensive health assessments completed within the mandated 60 calendar days of placement. We are proactively working with a wide range of partners on solutions for underlying causes like delays in insurance enrollment and limited dental provider access in some regions across the state. Again, while these are not perfect, it's not 100%, it's a positive momentum in the right direction. We are enhancing CJAMs to generate automated alerts when medical and dental exams are overdue, and engaging with local departments to ensure every child receives the care they deserve. The delegate asked the question that she said she was baffled. I agree with that word. I was baffled when I learned as secretary that the alerts didn't exist for our staff workers. These are the kinds of things that we're beginning to change over the course of time to make sure these are seamless in CJAMs and help our staff on the ground. On the issue of dental provider access, in some regions of our state, there are a few dental providers offering timely services. We're trying to be creative there as well. We are working with the Maryland Medical Dental Administrative Service Organization, dental providers, and local departments of social services to improve dental care for children in out-of-home care. We are also partnering with the Maryland American Dental Association and the Maryland Dental Action Coalition to improve access to oral health care. All of these things are trying to create forward momentum. On the issue of systems and reporting issues, some exams were completed but not found by the auditors because they were not uploaded correctly in CJAMs. We are pulling weekly reports to identify youth that need an updated medical or dental report, and we are meeting with our local departments to ensure every child receives the medical and dental care they deserve. We are also enhancing CJAMs to generate automated alerts for specialists, caseworkers, and supervisors when medical and dental exams become overdue. Again, none of these things were things that we walked into or were in place. So what's next? And what help do we need? We value our partnership with the General Assembly and will work together to ensure every child in our care receives the care and support that they deserve. Your work to pass the kinship care law is ensuring kinship families have the support they deserve to remain together and thrive was an important model of working together. And today, based on the growth in kinship placement rates over the last year, 260 more children are with family than just 1 year ago. We can use that same model of cooperation to tackle other longstanding challenges. While we continue to work within our statutory authority to direct accountability with team members statewide and to ensure policies are consistently followed across the state of Maryland, we welcome additional tools to encourage and enforce accountability in partnership with the General Assembly. Now more than ever, Marylanders deserve a Department of Human Services that models the highest standard of care and excellence. We are committed to investing in and empowering people to make real progress, to standardizing practices to hold ourselves and our partners accountable, and to implement policies that protect children. We appreciate your partnership and look forward to addressing any of your questions. Thank you.
Thank you very much, Mr. Secretary, and thank you to each of your team members and to the local directors who are here. We do appreciate your work. We know this is challenging work, and we are here to try and help make the system work better because, as you said and others have said, we are trying to address the needs of some of the most vulnerable among us. So I'm just going to jump right into it. There has been consensus that Maryland's licensed provider network for out-of-home placements is a priority, that building that is a priority. And that was articulated as such in the state's out-of-home placement and family preservation resource plan that was created back in 2023. On page 10 of the document that you shared with this committee and your overview and background, you say, and you said it in your remarks today, that in 2024, quote, we addressed the core problem that leads to youth experiencing hospital stays and hotel stays. And then the next sentence describes a new compensation structure, and you have articulated an important, the importance of rate reform and financial incentives for residential care providers. And can you, so you seem to link the two quite directly. Can you tell me with specificity how many additional providers and placements have brought online as a result of rate reform?
Certainly. First, thank you, Senator, for the question. First, let me address the way in which you're connecting those pieces. So we also see it that way, which is why we intentionally worked on rate reform. When we dug into the issue of what was stalling it, we had to look at how to create more bespoke services for children. And so we need to make sure that the right beds and the right least restrictive environments were available for children. We took a look at and deeply engaged with the provider community and understood that changing not only compensation to create a higher level of care, fairly compensated providers, and making sure we have excellence in everyone that was hired, working together to hold accountable the placements for children, and making sure that we were also creating a path forward for Maryland that was driven by evidence-based practice. That was connected to one of the things that we learned early on around, for example, Title IV e-claiming. The Family First Prevention Services Act passed into federal law allows for opportunities, for example, to use evidence-based practices to make sure we're creating opportunities to respond to children in placement. We learned early on that there was a massive disconnect there. So part of rate reform was setting a whole new standard and trying to reform practice statewide. We have taken a series of contracts to the Board of Public Works that did create new bed spaces. And in 1 second, I will pull up the number. Hold 1 second. You got it? Oh, go ahead. Let me finish this and I'll turn it to Webster. And are seeing tangible results. I want to conclude before I turn over to our Chief of Staff on the exact number on building that bridge with locals. It was our perspective, and I will say even my personal perspective as Secretary, that what had happened, particularly around evidence-based practices and creating new beds, was a disconnect that didn't actually treat, I would argue with respect and dignity, all the local departments as part of a singular statewide system. And what we inherited was looking at them as independently solving things on their own. We knew we couldn't do it that way. So we have statewide contracts for beds across the entire state that all 24 jurisdictions are able to access. And creating that structure and streamlined way of contracting is something that was really important to us. And Webster, please address the issue of the specific bed numbers.
Absolutely. And Madam Co-Chair, as the Secretary noted, rate reform is not done. We are starting the process, and in the fiscal year 25 and 26 state budgets, we have started that process. When the Secretary mentioned we brought contracts before the Board of Public Works this September, they were for child placement agencies. And so we increased our beds as part of phase 1 of rate reform from 1,921 beds to 2,013 beds, a net gain of 92 beds. We're happy to provide to the committee a detailed breakdown should you need that information.
I think more importantly than beds itself, and I think expanding the capacity, while it's important, is really looking at what are the needs of the children and the needs of the 14 to 17-year-old population, which are the ones that are most apt to be in hospitals and hotels and in other and office buildings, are very different, obviously, from a younger child. And so while it's wonderful to have more capacity, I want to make sure and want to relate how important it is to be able to look at what are the needs coming out of the community, and do we have the ability to meet those needs? Which leads me to my second question is, we are, and you have put out this letter saying that you will change the policy with regard to hotel stays and to office stays. And it is very clear that hospitals are not part of that policy, and neither are shelters. And so while this is, again, probably the 14 to 17 or 18-year-old population, it's really important to be able to address those needs and not transfer. So instead of going to a hotel with a one-on-one who may or may not be licensed, then they are in a hospital. I've been on the phone with many a hospital professional who says, this is not the appropriate place for a kid who has been here for, in one circumstance that I can think about, months and months. So why were hospitals and shelters not included in your policy?
So let me try to begin to address your question, Senator, with the logic around what we were trying to do. And I'm going to connect the dots to the 14 and 17-year-olds specifically. One of the things that we did early on was take a look at what we were learning about young people who aged out of Maryland's foster care system. And what we found was that in many cases, Maryland was not a leader in the nation around how we address this. And we thought, let's turn this around. How might we imagine Maryland being the first state to end young people aging out of care? We partnered closely with several national foundations, dug deep into the data, and we found a couple of things, which we've lifted up in testimony in previous budget hearings, that in most cases, it was Black teenage girls who were the ones who were aging out of this particular system. And the data showed us that predominantly, if you came into Maryland's child welfare system at around the age of 14, you likely never left. And when we learned that data, we asked ourselves, is that acceptable? And the answer was, it is absolutely unacceptable. And then the question goes, well, how do we begin to turn that around? Not by small tweaks, but by massive changes. And when we dug into the data of all the kids, not just Black teenage girls, we learned that in many cases, they had kin, if not in Maryland, somewhere else in the country, kin by blood or by choice. And national studies on science and best practices and common sense tell us that when young people are placed with kin, that their results are much, much better. They have far less behavioral problems. They are more likely to graduate from high school. They're more likely to be in touch and remain in touch with their siblings. From education to behavior to mental health outcomes are all different. And the choice was made to focus at the root cause, which is why we prioritized modernizing Maryland's kinship laws. The idea here is trying to desperately try new things in Maryland to not have to have children stay in either hotels or in hospitals. We chose to focus on hotels in particular because the risk of having a child in a hotel is far greater than having a child in a hospital where there are more eyes on that child. That is an imperfect choice, but every single day we have to make really hard and often ugly decisions that we don't want to have to make. And so by focusing on looking at the data, getting to the root cause of not having children in care in the first place, prioritizing kin, we've begun to make progress there. And so the hotels was part of a trifecta. First, get the data, get the scope and scale of things, then make sure we could make changes in rate reform to compensate providers, provide more bespoke services for our kids, and then ultimately pull the trigger on the hotels because then we had more opportunities. So the kids who are no longer in hotels from the last couple of weeks, they are placed with Maryland-based providers. Part of that is because of the way we've engaged the providers and setting new expectations. Again, imperfect as any of that may seem, all of what I just articulated is new and different for how we're approaching this in Maryland.
With all due respect, you didn't answer my question. Are hospitals part of that plan, long-term?
Long-term, yes.
Within a year?
Yes.
Okay. One of the things that was brought up by the audit was that 2 providers were discovered to have employed workers who were precluded by state law from working with children. Yet, they were still licensed to be able to provide services because they're licensed by the Department of Health to other agencies. And can you tell me what process is in place to notify other state agencies who may also have children in their care? And to be perfectly frank, I don't know that I care if it's a child that is being served by SSA or a child being served by DJS. If a vendor has concerns, and I know that there were some real concerns that were raised, one is, I'm not sure, I mean, of course, I think their license should be pulled until whatever is causing them to have it removed is rectified, and that there is look, we're in a situation right now that I think we don't have enough providers. And so I don't want to write off a provider that otherwise might be in a position to provide these services. So one is there a program, a team that helps to work with the providers to get them back to a place where they can legally, lawfully, appropriately care for children, one. And two is what system is in place to notify other agencies who might have similarly vulnerable children about the warning and about the problem that existed for SSA.
Understood. Thank you, Senator. I'm going to break this up into two components. First, I'm going to turn it over to Robin Harvey, who leads our Office of Licensing and Monitoring. A lot of the issues that you specified there are specifically under her leadership. And then I'm going to turn to Dr. Studsel to talk about working closely with providers around making sure we're continuing to provide services to children. So first to Robin.
Thank you. Thank you. So the Office of Licensing and Monitoring reviews any incidents that are reported to us. And they are by provider, as you said. And so what we do is, rather than have the onus on our case managers or our locals, we have those reports come to us centrally, and then we centrally notify our sister agencies if there is an incident involving their licensees or that could potentially impact placements of youth from their agencies. So we tried to take the onus off of a disparate kind of reporting system and say, send it to us, we'll make sure people get notified. When private providers find themselves out of compliance with a regulatory requirement related to their license, the first thing we do is look at a corrective action plan. And we ask the provider to not only look at the action individually, but to determine if this could be a systemic issue among the providers. Like, we want you to really look at, is this going to be a problem going forward? If we find that the license deficiency or the regulatory deficiency is significant enough that it could impact the safety and well-being of children, then we look to licensing actions, which could range from limiting a license to suspending a license to revoking a license, or deciding to not renew a license when that license is up for renewal.
And thank you. That is helpful. And you are responsible for the Social Service Administration, right? You are not responsible for DJS or another agency. That's correct?
Correct. I'm responsible for monitoring DHS licensed private providers.
Right. Okay. Are there circumstances where children who are in foster care are served by agencies who are also at the same time, at the same place, at the same site, serving children who are in DJS custody?
Yes.
There are. Okay. And so there may be a circumstance where you have revoked their license and DJS is still providing services to children in their custody. Is that correct?
Once we revoke a license for a DHS licensed provider, that children cannot be placed in that facility with our license. However, a provider may be licensed by several licensing entities.
Right. Got it. That's very troublesome, potentially. I understand that is a bigger issue than you all here, but I just want to put it out in the world that I think that is something that we need to take a look at. I'm not going to take up any more time, but I want to thank you. I also do want to note that our wonderful folks from the Office of Performance Evaluation are going to have indicated to you that they are going to do a deeper dive and a scoping evaluation, and so we trust that you will give them every time and energy in cooperating with that.
Welcome their partnership, absolutely.
And we are looking forward to getting some good information about that prior to the General Assembly reconvening, hopefully in January. So thank you very much.
In the interest of time, I know we have some members that might have to leave a little early. I'm going to wait until the end to ask my questions, but I think the first person that I saw was Delegate Johnson? Or Delegate Harrison, sorry, we don't have a board that indicates who popped up first, so go ahead, Delegate Harrison.
Yeah, it didn't matter which order. Good afternoon. Thank you all for coming and addressing us and responding to the audits. I had 3 areas, but one of them was specifically about the hospital overstays, and I'm not going to ask that because you had that. The medical exams that the foster care children should be receiving, does that include eye exams?
It includes all exams depending upon the age, what the age of the child is. So if the age is that they have an eye exam, most of them are pediatrician, they will have their eye exam done at the pediatrician site. But there's no specific, and Audrey can correct me if wrong, that says eye exam. It's the annual comprehensive health exam as well as the dental exam is what's in the regulations.
So we don't have anything specific in our regulations that may have a preteen or a young teenager to have an eye exam. Do they have to say that they can't see when they're in school?
No, that doesn't preclude us from doing eye exams. We just don't have the data on here documenting the eye exams because it's not part of the audit, but that doesn't preclude us from doing eye exams. If there's a youth who has a medical need, we address that medical need.
But they have to be able to articulate that they have a need. I'm trying to understand because if we're going to be taking care of children, you have to take care of the children.
Yes, absolutely.
All the way around.
Go ahead. Yes, sir.
Thank you for your question. So not only do we rely on a child to disclose, like we never put that onus on a child to explain why they have entered foster care. Whenever we are working with a family and we make the decision to bring a child into care, the local case team does a great job in getting information from the caregivers, whether that's the biological parent or if they're residing with an adoptive caregiver, a guardian, a kinship caregiver. So we get that medical history. One of the things we've done just within the last 6 months as we're working to improve our health oversight is working to build a better relationship with CRISP so that for every young person that's within our foster care system that we have care and custody of, there's an automatic exchange of data information to do what you're saying, to avoid having to ask questions. Right now, our health passport is a paper document that requires someone to physically fill it out and pass it along. So we're working to actually streamline and become more efficient with an electronic health passport as well as a data exchange so that we can see immunization, we can see medical, we can see dental, as well as seeing vision. And so we're working to do that. But right now, in regards to regulations and even with the federal government, you heard the auditor team mention the CFSR review. They're looking at medical, dental, and behavioral health exams. And so I think vision is one of those ways in which we can continue to modernize.
Okay, thank you. My second question relates to the providers. They're, every time we have an audit hearing, it's always a staffing issue, basically. We don't have enough. So we don't have enough providers for all of the children that may need it, which is why some of them are in hotels and hospitals, et cetera. But how many, do you know how many providers have left our system to go somewhere else to help, to foster other children? And I ask that because I know of a few who have done that because it's been difficult working with the state of Maryland with payments and, many issues, or several issues, I won't say many, with issues. And because of the lack of clear communication and cooperation, they've said, well, you know what? I'm close to DC. I can go right to DC and I can foster children because that's their gift, that's their passion. They want to help children. So do you have any statistics on that?
Madam Delegate, yes, we do. Since Dr. Studstill and the new SSA leadership team started working with our providers and doing its two-way street, both greater provider accountability and greater provider communications, we've increased our number of beds. And so with the child placement agencies, there were there were about 55 beds that were lost through providers. However, we added beds, as we mentioned, through the most recent set of contracts that were approved in September. With residential child care providers, there were 33 beds that were lost, but we added 59 beds for a net change of 26 beds. It's important also to note that as part of the SSA's provider rate reform initiative, previously each provider was kind of a one-on-one service contract mishmash. Now they're in categories of service, I believe 6 classes. And so if you're in, say, class 1, you as a provider agree, hey, I'm going to provide XYZ services to this pool of kids. That makes it a lot easier to start matching kids and finding the right spot. Previously, a year ago, Secretary Lopez would be on the line calling a provider CEO and saying, hey, can you please take Dr. Studstill or Alger? And the provider would be like, nope, sorry, I only take girls. And so that type of provider rigor, communication, and accountability has allowed us to have a better understanding of our system and to more quickly line up a provider with a kid. However, the most important part, though, is simply we're trying to avoid the provider system by using kin care, by choice or by blood, anywhere in the country. Because if we can keep them out of the formal system and support the kin, we support families.
And if I could add to my colleague to the last point of the delegate's question, we know when a provider leaves our continuum of care, oftentimes it's on the heels of a sanction that the Office of Licensing and Monitor may have issued, and as such, they may not be able to recover. Where we don't have information is if they leave our system or voluntarily submit their license, they oftentimes may not disclose to us if they're going to another state to provide service. So I heard that in your question. So we can tell you how many have left over a period of time. What we won't be able to do is explain where they have gone to do business unless they've disclosed that to us upon exit.
Or why?
Or why.
Sometimes they, yes, okay. Thank you. More conversation offline. Thank you.
Maybe an exit interview process for providers that choose to leave might be, or an exit survey would be a good idea. Senator Reedy.
Thank you so much, Mr. Chair, and thank you. I know we met a couple of days ago with your team. Thanks for making yourselves available, and we covered a lot of ground, so I won't recover it. I was curious if just, I think probably 2 specific questions. One is, when did you all become, these audits run through May of 2024. When are you made available, when are you made aware of the outcome of the audit? I don't need like a date specific,
No,
but
I'm
generally.
trying to think, and actually, so our Office of the Inspector General is the liaison to the auditing team, and our Inspector General updates us as it's progressing. And so I'm trying to think, it was probably since early September was when we first got a draft of the audit.
Of September?
Of this year. No, if I heard you correctly, for this audit, correct?
Right, because it says it ran through May of 2024. Yeah. Okay, because it's a year later. Got it.
That's
so
correct.
It was concluded.
So the audit period covers 4 years from May of 2020 to May of 2024.
And it was completed in the summer and then, gotten you guys were given the opportunity for feedback and given to you. Okay, okay. Why did it, that's good to know. I see some of the corrective action I think is positive. I still struggle with what the disconnect is with different SSAs that have had long-standing issues. And as we've talked about, there's 24 different ones. We don't want a one-size-fits-all for every SSA. We talked about that on our call because Somerset County or Allegheny County is different than Baltimore County or Baltimore City or whatever. I see some of what's been going on here, but as far as the oversight, is there a better way that we can move forward on actually making sure that we don't have these long-standing continued problems? What could is there a spot in the law that needs to be tighter? Or what is it that's kept you all, and I know it's not just you, but what has kept you all from going, we're getting reports about this in 2023. Why is it not, let's go intervene and dive in there now? What's kept us from doing that?
So I'm going to try to answer the question with a story, back to the word baffling, that just shook us in what we did. And this is in the weeds, but reflective of the kinds of absence of processes and systems. So here's an example. Early on, in the first few months of 2023, as secretary and many of the leaders were asking some basic questions to have, how do we have line of sight on some of the things across the department? And we had gotten a call, I'd gotten a call from senior leaders of a university asking about payments. And so I asked, well, how do these payments come in the door? The university issue came up. Turns out that there was a mailbox, an email that was set up where vendors were supposed to send their invoices to seek payment. And the person who used to monitor that had left DHS. Not weeks or months, but I believe over a year. No one had told us. We immediately, as soon as we found that out, to the issue of when we find something out, we act. I couldn't unhear it or unsee it. Put together in place a directive that actually talked about how invoices were going to be looked at across the department. And that there were some invoices over $50,000 that we were going to have to make sure came to the office of the secretary. We have an entire team, an entire infrastructure that every single day looks at these things because there was no department-wide system that I, as secretary, could have some level of accountability for. Number one. Number two, our deputy secretary at the time, who oversaw a variety of operations, Dan Waite, literally helped construct with Webster, Carnitra, and myself a system called Get It Signed, where our local departments of social services enter everything from the rent payment on their building in Somerset or Queens Anne's to actual contracts to pay sheriffs around child support administration. None of that existed when we walked in the door. None of that. So again, baffling. So when you think about how might we get some control and line of sight and therefore accountability, so we could answer a question like this and say, I can tell you exactly, Senator Reed, here's how it works. We can't always do that. And sometimes we stumble upon it. We stumbled upon it when not hundreds, thousands of invoices had not been paid. Retroactive to years, the opening slide on a budget presentation to DBM, and I think it was in our first year, was a pile of bills for Verizon Wireless. You know what those Verizon Wireless bills were for? For the cell phones of our caseworkers. And as the secretary, it is my responsibility to try and solve it. So in those examples, building a Get It Signed, a staff member, a deputy secretary built it by hand with this team. And that's how we began to change both the culture, the practice, and the system so that this doesn't happen ever again. You should not have to sit here and listen to decades of repeat findings. And so while I would be remiss to say, I can promise you, Senator Reed, we're going to solve it all in 6 months, I'd be a liar. But we are doing everything we can to try to problem solve at the root cause, turning a very different direction of both culture, change, and accountability to not have these issues continue to occur.
Okay, thank you for that. And the last question it would be, we have the directive here about no more hotels. And as I said on our call, I actually understood that there might be times where you had to triage, the department historically had to triage in some way. The frustration was, how did some student get left by themselves? And we talked about that, and obviously it's unacceptable. And I'm sure there'll be other questions about that. Why did it take till October 22nd to issue this directive? Because it seemed, the appearance is, oh, it blew up, and now we're issuing this directive. I mean, can you speak to that?
Certainly. I'm going to tell the truth, and it will not resonate with everybody. The first thing we had to do was get a handle on what children were in hotels and why. When we asked the questions early on, we could not get consistent answers. So as I said in the opening remarks, that ultimately we began to ask SSA to track this and to help us understand. From what we understand, most of this was tracked manually on spreadsheets across 24 departments of local services and not fundamentally centralized at SSA. That was unacceptable. So first we tried to prioritize data analysis and data collection. Then once we had a better handle on that, we tried to get a handle on how do we never have a child in a hotel? And we looked at, again, the data on why children were in care in the first place and what's happening to them. We looked at the issue of not having appropriate placements with kin and focus on that. I lifted up modernizing Maryland's law. We talked about this on your call. Again, yielding some early results and important results. We also looked at the root cause of the mix of providers in the state and unstuck the decades stuckness around rate reform. Those three pieces were the trifecta that grounded this work. We had wanted to be able to issue a directive earlier, and we didn't. And ultimately, at the end of the day, we felt that because of the progress that had been made in these 3 areas, we were able to do so and to prioritize placement of children in Maryland state provider organizations. So when we mentioned earlier, I forget which one of you asked the question, all the kids who have been removed from hotels in the last couple of weeks alone, let alone the last couple of months, have been able to be placed in Maryland organizations. That was an enormous priority of ours to secure that. Are there instances, for example, again, complete truth, where a child's needs aren't be able to be matched by state-based providers and they are then cared for by out-of-state providers? Yes, that does happen. But this team has prioritized focusing on kin first and focusing on the least restrictive placements possible that meet the child's needs. That is the truth.
Delegate Johnson?
Thank you, Madam Co-Chair. And thank you for bringing the information to help us understand kind of what's going on here. I've got a couple questions. First, you spoke about vacancies, but that was kind of during the COVID period. So what do the vacancies look like now? That's one. We spent over $600 million for a new computer system. Is that computer system being maximized to address some of these deficiencies, especially the repeat deficiencies? And my third question is, how many guardianship homes approximately do we have? And is there a process in place to monitor these guardianship homes after placing children? Because I was really troubled to hear that not 1, but 7 sex offenders were addressed with a guardianship home and given access to the children. So
Certainly. Let me start with the first one, and then my team will help me remember all the things I was looking for an answer. So let me talk a little bit about the vacancies. So it turns out, as I talked about in the earlier part, these were recovering from COVID, but it wasn't just COVID. We looked at this not just SSA, but across all 24 departments of local services. So for example, and this is worth repeating, we dramatically lowered the caseworker vacancy rate from over 17% in November of 2022 to just over 8% in September of this year. So that is an important reduction in vacancy on the frontline caseworker status. On the issue of supervisors, which directly work with caseworkers across the state, we reduced supervisor turnover from 22.26% in May of 2024 to 12.37% in May of 2025. We also increased the overall team experience by nearly 2 years, from 9.54 years in November 2022 to 11.53 years today. And these particular data points that I'm mentioning, sir, are also related to findings in the audit. Now again, not done, but headed in the right direction. Overall also, when we came into office in 2023, the Department of Human Services had one of the highest vacancy rates across the entire department. We prioritize using existing Maryland tools, for example, like same-day hiring, which had not been done. So I might be at a job fair, you might apply for a job, you might qualify, we interview, and we'll say, we'll offer you a job doing XYZ in this ABC department in Somerset County, pending the final background check. That helped us get, overall the department, we're just above 7% vacancy rate in the department. That hasn't happened, I don't think ever, but certainly for at least the last decade for our deputy secretary who oversees talent and customer service. So I just wanted to lift up those few key pieces where it's lifted up in the audit findings and we were deliberate about trying to bring these vacancy rates down. On the issue of guardianship.
With respect to MD.
Go ahead.
With respect to the IT systems, Delegate, the $600 million number that you quoted refers to the entire, what we now call Maryland benefits, and 3 major computer systems. With respect to specifically CJAMs, the Secretary's already spoken about the transition from MD Chessie to CJAMs. What we've done since 2023 is every single IT project, enhancement, whatever you call it, is mapped out going forward to 18 months. There's a project plan, there's a project budget. We're holding people to it, and then we're prioritizing what's the list of things that you have to do critically and the things that you have to go down the list. So it's in priority order, and there is a long list of fixes that we've had to implement. In addition, with respect to guardianship homes, Our colleagues report that there's 2,094 guardianship homes currently. And yes, I'll turn to Dr. Studstill to describe more about our discussions with guardianship home oversight.
And so one of the things that's important, thank you, Webb, when the auditors conducted the matches with the sexual offender registry, they did so in different caveats. And so they looked at 240,000 unique records. And what they found was no matches for individuals that worked at SSA, vendors, or foster care parents. There were 7 matches for guardianship homes. And when we reviewed those cases, what we understood was at the time, and I think earlier on in the Secretary's opening testimony, before a court determines guardianship, there are requirements to ensure everyone that's living in the home at that time is completely fingerprinted, background checked, all of the necessary things are done, and then that information is presented to the court. At the time the court receives that information, they then make the final determination on if the guardianship is to be approved. Once that guardianship is approved and the case is legally closed, currently, there is no statutory authority that allows us to maintain ongoing oversight of that particular guardianship home. And one of the things my colleagues have lifted up is that we look forward to working to the legislature and figuring out how best we might be able to address that. And then in one particular situation, the court was aware, because being on the registry doesn't always mean that you have restrictions with children. The court was aware in one situation of a sibling that was in the home and ensured that there were plans in place and approved for that child to be in that guardianship home once all of the information had been presented by all of the legal parties.
Yeah, I also wanted to say,
I think it's working. Go ahead.
with respect to did we check on those 7 cases? Absolutely. It was the first thing we did was check on those 7 cases. And then second, I want to remind people that guardianship is not foster care. It's not a placement. It's a legal family, like an adoption. And there are limits. There should be limits. But we could talk about what those limits are and what they need to be in Maryland. But there are limits on what the state agency can do for monitoring a legal family. So I just want to be clear, because we talk about guardianship like it's a foster care placement, and it is not. It's a family.
All right, thank you, thank you.
Thank you. I just want to follow up on that line of question, and this has actually been, I've been thinking about this for a while. Of course, it is important to ensure that those 7 situations, that there's follow-up. But the people who were on the sexual registry were also in violation of the terms of being on that registry. And was anything done to follow up about that?
So for all of those 7 cases, our team, when we were notified, we made contact with their respective probation officers, and those probation officers reported no concerns to us. And we also attempted in several of those situations to request a well child check from local law enforcement. In many of those situations, because there were no current allegations or concerns, local law enforcement refused to take any further action.
Okay, I just want to make sure that was followed up on. Thank you very much. Senator Hester.
Thank you very much, Madam Chair. I was just looking at the full audit report and looking at, where there's this discussion of, authority, particularly in finding 2, there in the agency's response, it states that while our mission is to ensure the safety and well-being of children, we do not have legal authority to conduct ongoing monitoring background checks on individuals interacting with a child after a court-ordered guardianship is terminated. And my question is, if you don't feel like you have the legal authority at this point in time, first of all, are you going to be introducing a departmental bill that, completes that gap in legal authority? And secondly, we had a long hearing, I don't know, a couple weeks ago on boards, Department of Health boards. And I'm just, where the secretary, might need more authority all over those boards. Do you need more authority over all of these local SSAs?
I think that there's a couple of things, and I've thought about this a lot, Senator. Something that I've mentioned to our team and to our leadership of the local departments of social services, that just like any other field that requires consistent learning, continuous education, say a doctor, a medical field, and changes in best practices, there's certainly room for improvement about modernizing the relationship between the department, and specifically SSA, and the local departments of social services. Many of the structures that are in place whether it's MOUs with the state or the balance, which was asked about earlier between county employees and state employees, is all over the map across the state. That kind of reform, that kind of authority begs major policy questions for the General Assembly around what is the kind of relationships you would like to have. So if asked the question, is there room for improvement? Without question. Is there room for clarifying authority, not just between secretary or executive director and the LDSSs? Absolutely. And we would partner with you to think that through. All of these things have major implications that would take several years to ultimately implement, because in many cases, in some counties, 100% of their staff are funded by the state of Maryland. In some cases, almost 100% are funded by the county. And yet we are responsible, we, this team, are responsible for answering questions to you about accountability. So there's lots of room for improvement there, absolutely.
Madam Chair, if I might just ask that this line of questioning be included in the work that the Powell is going to do. I think it's really important to clarify that authority and also the financial model. Thank you.
I was going to say, thank you, Senator Hester. Yeah, that is, I think, a much longer term question. That's why I asked the audit folks, and I know we've had that offline conversation. I mean, again, to what was discussed earlier, that is in many instances, a choice in which DHS delegates the authority. So I think we want to know, I go back to that SHA example, right? Like, I know that when I talk with the District 3 engineers, that is a direct pipeline to Central MDOT and Central State Highway. It's not that District 3 is operating in a silo and doing whatever they want, that when they have to approve a road improvement, that is being looked at through the entire system, and the data that they're getting is then being given to the entire Department of Transportation and reflects their overall policy choices. And that's, I think, where we ultimately want to go. I mean, I know Senator Reedy has stepped out, but obviously every jurisdiction is different. Just like, again, dealing with an issue in Somerset County and their roads is different than dealing with an issue in Montgomery County, but that doesn't mean that we can't have standard practices. Agreed. And that we can't know that if somebody is, not doing their job appropriately in one jurisdiction, that there isn't a standard operating procedure to hold them accountable and make sure that data collection and things are consistent across the board. So I would echo Senator Hester's statements. I think we want to make sure that you tell us what authority you don't have that is preventing you from holding local folks accountable. And if that bifurcated relationship with counties is not working, we want to respect local jurisdiction and local authority, but not at the expense of our kids.
Agreed.
Because the buck stops with us, the buck stops with your agency. So thank you. I know in the interest of time, some folks do have to get out of here again for other commitments. So I'm going to jump the queue to Delegate Smith.
Thank you, Mr. Chair. First, I want to say thank you to the team for being here today. And also, I didn't get to salute the audit team for your findings and presentation as well. I just have two quick questions, and I also hope to make sure we clarify the record. I know that there's a difference between fostering, there's a difference between being in a guardianship home, and a difference between adoption. There seems to be across their tenure difference slightly. And then also there seems to be a difference in the extensiveness of the vetting of the parents, right? Well, this is where I'm asking for clarification, because I'm not understanding, I know there's legal prohibitions on what control you have to monitor after guardianship, but I'm not understanding if they're really, I just want to make sure we're not conflating adoption and guardianship, because there seems to be a slight legal difference. And I just want to make sure we're being very clear, because I think many of us know people who have adopted. We know that extenuating review, the home study, there's a lot that goes into adoption that looks very different than a fostering and perhaps even a guardianship home. And so I know that there needs to be some legal remedy in order for you to be able to continue monitoring. But I want to know, one, are there any examples from other states that you look to? I've been trying to do some cursory research while I'm sitting here. And if you were to have some type of expanded monitoring post-guardianship home placement, what would ideally that look like for you?
Heather, before you answer, I'm going to say one piece before Heather answers, who's a lawyer also by training and knows this. But before I want to say this, at the end of the day, you're asking really big policy questions about how the state of Maryland wants to posture itself on all of these issues.
Yes.
So I want to, the reason why I say this is because when one opens up Pandora's box on any kind of vetting for any kind of family, then to be equitable, it's all on the table. And I'm not saying that you wouldn't support that. I just wanted to say that out loud. And so right now, Heather, if you could speak to the issue in the first part of the delegate's question related to how we are rigorous, or we attempt to be rigorous in all instances. Thank you.
So there's different ways that guardianships come about.
Yep.
The ones that come about through the foster care system start as licensed, well, for our kinship guardianship assistants, start as licensed kinship caregivers. They go through the same licensing requirements for any out-of-home care provider, same background checks, all of those things. And while they are still a child in need of assistance case, they remain in our care and custody, cared for by the family. There are a couple of options that can come out of that, a few options. One, the child could be reunified with their biological family. Two, it may be in the best interest of a child to go into a guardianship, a legal family guardianship, meaning that the parents' legal rights are not terminated, but the guardian has healthcare rights, education rights, all of the basic care and custody rights, including the right to protect and the obligation to protect the child. The adoption is similar, except it terminates parental rights. There's a whole bunch of reasons why it might be in a child's best interest to do a guardianship rather than an adoption. So that gives you a sense. The big bifurcation in my mind is once a court says, this adult, this family has the legal obligation for the care and custody of the child, the Senate case is closed, we no longer have an authority to monitor that family. They become a family like any other Maryland family. If there's a report of abuse or neglect, there's an allegation of abuse or neglect, we hands down go in and do all of the things we would do for any other Maryland family.
Right. Okay, so I'm hearing maybe there's some hesitancy to examine a proposal. I don't know, maybe, I'm just trying to hear what you're saying.
So I'm open to some stuff we might be able to do administratively in our guardianship assistance agreements. And I'm very open to having a conversation about how and whether continued monitoring after legal guardianship is established could work. There is no other state that does it.
Right.
So that's why you haven't been successful in finding another state that does it, because nobody does.
I was just going to actually, go ahead.
One other question there, but they are still going back to court to get financial remuneration from the state. Is that correct?
They do.
They don't go back to the court to get financial. As part of, just like when you do an adoption subsidy, there's a guardianship subsidy. So it will be the same thing with an adoption home. We have adoption homes that get subsidies, and we have guardianship homes that get subsidies. So those agreements are done when the case is closed, and then that's how we do the same monitoring for our guardianship home subsidies as we do for our adoption home subsidies at this time.
And what is that? Does that look like a check in the mail, or what does that look like?
Direct deposit.
No, that's not the subsidy, but what is the
annually?
What is the redetermination?
Oh, the redetermination. I'm sorry, I thought she said the check in the mail. Sorry.
No, that was an answer. That was the answer.
Okay.
But keep going.
Well, Elton, I would like, you're right, it's okay.
And so subsequent, aside from the direct deposit, there is, at the time of redetermination, they do have to provide information on if there have been circumstances that have changed, if they've moved, any of those things. And there's a time period. So the local department will send the notification, I believe it's a 3 to 6 month window ahead, and then the family must respond. If there is no response, the local department has authority by way of current regulations to terminate said subsidy. And then there's an appeals process if the family comes back and says, I meant to resubmit and I didn't do it.
Is that an annual redetermination process, or how long a period?
Annual.
Annual, okay. So there is an ongoing relationship between the family and the state. In some respects, I understand that it might be limited, but it's not, you're totally hands-off.
Right.
Right? Correct. Okay, thank you.
Okay, yeah, I just had one more clarification question, because I think this is really important, because the lack of something happening in another state isn't always that persuasive to me, because a lot of bad things persist as national kind of postures. I just want to put that on the record. But I also just wonder, I saw on your remarks related to, I believe it was the findings in 12 and 13 about the changes to the finance office to maximize reimbursement. So on one hand, we're discussing how to increase payments from the state to people who are providing these services to these vulnerable populations. But we also had a really scathing kind of finding of all the missed opportunities to recoup federal dollars that are in your control. And so while that one sentence sounds nice, I would really like you to further unpack what does that really mean? Because at the same time, the state is being asked to step up its support of people that are stepping in here. I think we want to have stronger assurances that the fiscal oversight to recoup any dollars that should be coming back to the state are at the top thresholds possible. So could you please unpack that?
Absolutely. That is another one of those confounding findings. And when we look at what is the existing infrastructure to make sure that doesn't happen, there's two components I want to bring up, and I'm going to ask Webster to speak about the changes in the Office of Budget and Finance specifically, and some of the things we actually had just done the last couple of years for the first time, including our budget, which actually, Webster, why don't you start there, because I think it's an important opening around this, how we were using how we were submitting the budget for the first time in a very different way. And then I'll talk about the Title IV directly to the delegates' questions on capturing federal reimbursement.
And I think it's safe to say that just as we've brought in new leadership and really focused on SSA, we have done the exact same thing with the Department of Human Services Finance Office. Prior to fiscal year 2025, we had not loaded the budget fully in detail into the state's computer system called FEMAS. When we started talking to our colleague state agencies, everyone was like, what the, with your facial expression right now. Last year was the first time we've done that. We have made a lot of changes to how we address things. And one of the key points that I think we have discussed in our budget, with the budget committees, has been the lack of federal claiming. And I think that addresses head on. When we first started, even though Maryland was one of the very first states to have signed on with the FFPSA, we hadn't really made use of that and claimed and drawn down funds. Since we've started, we have increased that, and I believe one of the more recent numbers is we've drawn down $5 million. That's still partial. That's not as much as we probably could. We are improving that right now.
And to that point, Delegate, that's why I wanted Webster to frame this up first on the budget. One would expect these systems to be in place. They were not. Though Maryland was the first, as Webster said, to submit a prevention plan, we drew down $0. And when we went to look at what is the root cause, it was a lack of consistency in even entering information into CJAMs. We took a team, I think it was 7 or 8 consecutive days, hand counting and looking through, I think it was 1,424 cases. I might be off by a few numbers, but something like that. And as a result, we're able to draw down $5 million in federal money because Marylanders deserve every federal dollar that we put in the federal system. But to your point, that was only captured where we can go back. And a lot of that is trying to recreate systems and data that we simply can't create. We can't vouch for the integrity of that data. So that is an example where then, what did we do? We actually brought in a national expert who helps states figure out how to build systems, put in place a policy and a practice. We invited those experts, including national foundations, to train our staff, first with the Office of Budget and Finance, then all across SSA. On Dr. Studstill's team, he had very little to no experience in the appropriate drawdowns. So building it at the Office of Budget and Finance level, building it at the SSA level, ultimately so that the Office of Secretary could have insight into where we were. We never want to have a situation where we're not drawing down federal dollars to which we deserve and which we are entitled to.
Senator Brooks, go ahead.
Thanks, Chair. Thanks, Mr. Secretary. Quick question.
Yes.
I'm looking at the report overview that's on page 2, and there were numerous related findings or repeated findings and that weren't addressed. So what are the consequences for not correcting previous audit deficiencies?
Senator, I think if I understand your question correctly, the first part is simply, we are before you and we are on the equivalent of academic probation. To be really simple, we have to give regular reports to both the budget committees, and we're going to be in front of you all, best friends, to say, hey, Senator, finding 1, this is what we've done. Is this all right? Is that an A+ grade or not? But to your, I think, fundamental question, Senator, it's to what the Secretary said earlier which is what do we do moving forward so that we are positioned in the next couple of years to eliminate that repeat finding and to change our departmental's culture so that it doesn't happen again.
Okay, but it's almost like a two-part question. So, and the other part of that, I know that there could be a loss of funding. I understand that. DHHS or MDBM could impose fines and penalties. The SSA could be placed under a corrective action plan. So has any of that been done in the past or imposed in the past?
Oh, I understand your question now, Senator.
Yeah.
So I'm going to refer to something that we talked about earlier, and actually Dr. Stetzel also mentioned. In a previous life and role, I ran the very federal agency at the United States Department of Human Services who was responsible for overlooking all the states on these issues like the CFSR, which is Child Family Service Review. Yes, Maryland has historically been deficient on these issues. Our auditors brought it up. And what we were trying to do is build an infrastructure in SSA to avoid this from continuing to happen. So are there financial penalties? Yes. Did Maryland have those? Yes. Are we course correcting them as a result of what we've learned? Yes. We're building literally in CJAMS new features to make sure that we can respond to these findings. One of the many things that Dr. Stetzel has to worry about is making sure that any repeat findings, not just for the state in terms of like our auditor team here, but also the federal government, because we don't want to lose funding. So the stakes are high across the board, not just for being accountable to you as members of the General Assembly, but also the federal government. Because let's also be clear, most of that money that's funded for these services in Maryland come from the federal government. And so we want to make sure that we are serving everyone with excellence and can be really directly accountable on all of these factors.
All right, thank you. Thanks, Chair.
Thank you. Delegate Plakovich-Carr.
Actually, I think some of my colleagues were ahead of me in the queue. I'm pretty sure I'm the last person.
I apologize. Delegate Lehman?
Thank you. So thank you to the panel and the work you're doing. There's obviously a lot of room for improvement, but it sounds like you're trying to get started on that path. And I want to take a minute to thank all these advocates that are here in this room. Thank you for the life-changing and life-saving work you're doing on the ground, in the field. It is very, very much appreciated. And thank you for spending time here in this room today to hopefully learn some things and figure out a way forward. I'm very fortunate to have a constituent who is here today, who is an advocate and a foster care parent that sort of schooled me on some of these issues ahead of this discussion. And I have to admit, I did not realize that Maryland housed foster care kids in hotels and offices. From a quick look online, it looks like roughly about 24 states do that. So we are not alone, certainly. But I wondered if, given how, given the problems, the supervisory challenges, the enormous cost of putting up kids in hotels and office spaces, do you have as a goal to not put our kids in offices and hotels? Is that a stated goal of this agency, short-term, long-term?
Let me begin to address that with something I said earlier on. It's worth repeating. And I'm going to, anyone at this table who's worked with me or anyone who is in the audience who has worked with me knows, I don't ever try to use the words placed in a hotel, because a hotel is not a placement. I also need, just for the record,
well, Mr. Secretary, respectfully, online, I read that there's actually, the term is used, it's a verb, hoteling.
Understood.
So if you want to call it hoteling, that's fine.
No, I'm trying to, because at the end of the day, which is why we have been working so hard, there should be no children in hotels. And so can I say to you publicly, we are working to end that practice? Absolutely. Is anything that we've said so far perfect at absolutely solving it? No, it's not perfect, but you will always catch us trying to bring about change on this issue, number one. And you actually referenced it. It is a national issue, and it grew in practice during COVID. Though I wasn't in role, I can understand why. I'm not trying to blame former leadership, but at the end of the day, now it's our problem. And we want to work with you to never have it happen again. So again, for the record, as of this morning, 5 children are currently experiencing hotel stays from 3 different counties in the state of Maryland. And as of this morning, when I confirmed it with our executive director, there are active plans for all 5 of those children to soon be out of the hotels. And once that hits 0, my expectation, based on the directive, is no local Department of Social Service will facilitate any stays in hotel ever again. That is what we're committing to publicly. It is what we've worked on in the department. On the issue of offices, I also want to be clear about this, and I understand this has happened. So you are accurate in that there have been times where young people have stayed at an office. They are never to be placed there. So I'm going to give you an example recently, or let me go back 40 years. Maryland is a state that is the only state in the nation with 3 child welfare lawsuits, the first of which was entered into with a consent decree almost 40 years ago. We have been working very diligently to try to make sure that we create a Maryland system that ultimately never puts the state where we're the only state in the nation that has 3 child welfare lawsuits that we're negotiating or dealing with. On the issue of offices, one of the issues in the consent decree is that for particularly Baltimore City Department of Social Services, which is squarely was the matter from 40 years ago, that they have a 24/7 building. And if a young person who's in a placement, so Carnitra might be the young person, and she has a placement, and she leaves that placement at 2 in the morning and shows up at the 24-hour building, that child will be welcomed in that building at night at 2 in the morning. And the logic right now, again, however hard and painful it is to make sure Carnitra is not out in the cold. Now, in the case, we have to track every single day, and one of the things I look at every single morning with this team is any child in that building for more than 4 hours. We track it every single day. And we ask, literally Carnitra and I, why was that child there? Is there a placement? What are we trying to do? Because every single child deserves the respect and dignity to not have to go to a building. So I wanted to give you a little bit of context, because when I hear that people are saying that we, the Department of Human Services, are placing a child in an office, I know that's not your language, Madam Delegate, but it's one of those things where I really wanted to correct the record. We would never, no one on our team across all 24 departments of social services would ever say to 13-year-old Carnitra, we're placing you in an office. That is not the way we work, and it is not what any child in Maryland deserves.
Well, I understand your sensitivity, I really do, but I do think it's a distinction without a difference. But I want to move on from that and ask so 13 states, including our neighboring states of Virginia and Pennsylvania, use this model, nonprofit model, Isaiah House. And it's like temporary housing, group housing for foster care kids, fully staffed until they can get into a family-based placement. Is Maryland open to that model? Has that ever been discussed?
We are open to exploring countless models. And so, for example, one of the things our team
is there anything to preclude us from using that model?
Well, I don't know that model myself, and I would never say yes to using a model that I haven't researched with our team and understand the results. But we are open to absolutely any model that helps us end this practice. I will say that right now, we have a variety of opportunities. For example, in looking at the hotel directive, for example, we wanted to make sure that there were providers who would make sure to take our children 24/7. So if a child, back to the example I gave, came at 2 a.m., that rather than sitting in an office for hours, even though they have access to food and clothes and showers, et cetera, that they would be in actually a respite care home. We are working desperately to make sure that we provide opportunities and other resources. So if Isaiah Homes, again, we'll look into this model, and we're happy to get back to you, ma'am, is one of those such models, we're happy to look at those. We are not close to any idea that's going to both modernize and ultimately hold Maryland accountable for never having to use hotels or offices space again.
Thank you.
Certainly.
Delegate Harris, go ahead.
Thank you, Mr. Chair, and thank you for being here. This audit's a little personal, but suicide's not absent in my world. I've seen it, and I'm a little concerned. Of your team up there, what's the tenure of each one of you? How long have you been with the department?
Let me start.
I started with the department in July of 2023.
23?
I've been with the department for 32 years.
I joined Inauguration Day in January 23.
I joined in March 2023.
I joined January 2024.
I haven't been in this position for 32 years.
No, she has not.
I've been with the department for 27 years. I started as a case manager.
Okay. And, you know, I looked at this audit and I went back to it, and one of the things, I've been on this thing for quite a while. One of the things that I noticed in here is you had repeat findings. So a lot of you, when you took the job, were aware, or maybe you weren't aware of the repeat findings. Were any of you aware of them?
So I guess I'll start as the executive director. So when I assumed my role, yes, I was briefed by the team on those findings. What I will say, and you heard in the opening testimony, but since 2020, there had been 3 predecessors in the role. And when I was briefed, none of the individuals that were briefing me had been here during the prior audit. So they were briefing me on information that had been passed down.
What concerns me, and I work in a business, so I look at things a little bit differently. You all had a blueprint for what's wrong here. That blueprint was the last audit. And when you look at that last audit, and I went down through just the repeat findings, and you talk about the oversight of your LDSSs, okay? I wonder why that wasn't addressed quickly. If you have the potential of sex offenders, background checks, whatever, the lack of reporting and all that stuff, I might have started there. I might have started it back with our guardianship and trying to look at the health issues. I think if we would have addressed these findings, the repeat findings, which is paramount, because a lot of these things would have cleared up a lot of the reasons we're here today. It's really sad that we haven't mentioned Kanaya Ward. I mean, it's a sad thing. Somebody's dead over this. And we're sitting down here with I think, Mr. Secretary, you said in your letter, you said, I inherited significant deficiencies. Right then and there tells me you all knew you had problems, yet those problems continued for quite a long time. And we lost a life. And we don't even know what happened to the other kids in hotels. I'm not so sure a hotel is the thing. I think the process and the attention and the care might have been the problem there and how we address things. So I'm a little concerned about what's happened here. And to sit back and give me a list, if I read through what you're going to do here, that's what I would have wrote. I sit back and say, I got a lot of problems. Here's what I'm going to do. We run into this every audit. We listen to what the auditors say, and then we get a little bit of a list of sitting down. Here's what we're going to do, and we're going to fix this problem. And here you are 4 years later with a history, not your history necessarily, but a history of things, and we're repeating them when you knew about them coming in, and they've not been addressed. I'm not saying you dedicate and fix that. You might lack somewhere else. But this did not have to happen, in my opinion. We have people here, and these jobs are very, very important. And to sit back and say that these processes that were lacking were never in effect, I mean, the lady that's been there for quite a number of years, I think you could testify that you know what to do. You probably understand a lot of these things. You're probably questioning why weren't we doing them. And I just question the group on sitting back saying, we had a chance to fix this stuff. You know, coming in here, we change secretaries every 4 years, 4 to 8 years. That's not the answer. These are our most vulnerable people, wouldn't you agree?
Absolutely, sir.
And I question, how did these things get through the cracks? I mean, background checks, criminal background checks, sexual predators, and a gentleman on the right there made a comment about follow-up. I mean, why wouldn't we be checking with the fact that maybe my wife and I adopted a child, and 2 years later, I married somebody else and they're a predator? Why wouldn't we be following up to protect these kids? That might be something for the future. It's not what caused this problem. But I guess I look at this and we're kind of cavalier with these answers, and I appreciate that you actually did it. But it troubles me as a delegate, as a father, as a parent, that we're here and we're having these discussions and we're just talking about, well, in 2024, you know, it's not a coincidence that all these things started happening in 2024 to fix it. Somewhere along the line, these auditors let you know, and you probably had privy to some of the problems. So we started addressing them. And I wonder, and I'd like to hear your rationale, why weren't these first on your list to address?
Sure. Let me preface my answer with, there's a possibility that my answer will not be satisfactory to you, sir, but I can speak to you from my place of truth.
Right now, sir,
no,
it won't be satisfactory because we know where the circumstances.
Understood, but I want to speak to you also as a father. I'm the father of 2 boys, and I can actually say the name Kanaya Ward out loud because it actually has been in the public domain.
I appreciate you saying that.
But here's why, and I want to be very, very extremely cautious about what I say, because in the role as secretary, it is the utmost important to me and to my team and legally to protect the confidentiality, not just of Kanaya and the circumstances surrounding her death, which we are still investigating, but her family. And there are pieces of what's been in the press that I cannot speak to in the role as your secretary in the state of Maryland. And I'm not making that as an excuse or hiding behind the law. That is the law in Maryland. And part of that is because we want to protect the privacy.
I understand.
No, so I'm saying, I'm being very sincere with you, sir. So number one. Number two, my heart is broken over this death. And I ask myself every single day, if we had moved differently and faster on any number of issues, would this precious life still be alive? And every single day, I'm one of the people up on this table who reviews the ugly part of humanity and the reason why children who are traumatized and suffer are experiencing foster care in this state. And I've always said, my whole life and career to which I've dedicated this work, that I have never met a child experiencing foster care that says, yes, please sign me up. That they want to be loved and they need to be raised in a family. Governments cannot and should not raise children. Families do. And so on all the issues in this audit, did I, on the first day on inauguration, when I left Annapolis and drove to our office at the time in downtown Baltimore, have a magic wand or a magic solution? I did not, but I'll tell you, sir, every single day, me and this team have worked diligently to try to solve these. I'm not going to make excuses for some of the things in this audit. I can't, I won't. Ask my team. I will say I will not defend it. I am driven by integrity, and I am holding myself accountable for things that I had nothing to do with, but I own right now for you and for the people of Maryland. And I will hold my team accountable, not just at this table, but all 6,000 plus members of this department. I'm sure there are many, many dartboards that have my face all over them for the way I've challenged the status quo. Again, I know that we can get through this together and that we can bring about the changes that I know you are demanding and you are seeking, and you are right, sir. We lost a life over these issues. And I will not rest, and this team will not rest, until we deliver something far better, because that's what Marylanders deserve.
But do you think anybody in your department was malicious in any of this? I don't think so. Why wasn't it being done before you came?
Sir,
these are standard operating procedures, I'm sure.
I understand, and I think the question was asked earlier of the auditors who asked, like, was there not a policy, or were they just not following it? They answered it the way I would right now, both. There are some things, sir, that I do not understand how an SOP, a standard operating procedure on how contracts would be signed, wasn't streamlined across the department. I don't know why. And I would be remiss to try to characterize previous leaders in this role. Carnita said it best. She might have been here 32 years, but she's not been in this role for 32 years. And so what we're learning is, how do we listen in deeply to our leaders in the local Department of Social Services, who also have been advocating for some of these changes I've learned for decades to no change. And I don't know why, sir. What I do know, and I've heard says repeatedly to my team, I can't unhear something. I can't unsee something. And in the role as secretary, when I hear or see something, we move and we act. When I lifted up earlier, sir, the example of the streamlined and standardized statewide contract on one-on-one service providers, I was floored to learn that we've never in this state had a singular way of holding one-on-one providers accountable. Never. I have no idea why. But what I do know is when we learned that in role in the last couple of years, we jumped to change it. Now, it took us some time. We literally, I think it was over a year and a half, finally got 2 of those contracts approved by the Board of Public Works in September this year. We didn't just start that a month ago, sir. That was started, gosh, fall of 2023 maybe? When that first came to our attention. The remaining 22 jurisdictions are part of one package. Those contracts will be, I believe, either the last meeting in December or the first in January. In early 2026, I'll be able to say to you that for the first time in Maryland's history, which is sad, we're going to have a statewide standardized contract on one-on-one service providers. I have no idea why, sir, that has never happened. But I'll tell you this, in so long as I serve as secretary, and on any given day, I can be fired on any given day. But I will not rest until we get those contracts in place to never have that happen again.
There's more to it than just what you just said. I appreciate what you did. But when you look through the audit and you look through the deficiencies of what are happening, billing, reporting, these things, these are everyday fundamental issues that are in a department forever.
Agreed.
And we could have addressed these, we should have addressed these immediately. Like I said, you had a roadmap. You had at least, what was it, at least 4 that we show in the audit, and you said 6 of 8. That was exactly telling you this is a way that you can now move forward. Again, you're putting processes in after the audit too. Keep that in mind. And it's awful suspicious when you read 2024, the audit finished in 2024. That's a problem for me personally, because these issues were there before. And that's where I'm coming from. And I think we need to get better at it. Not only your department, but we come in here, like I said, continuously. We get your little wish list here of what I'm gonna make my department look good. And I can do this. I could probably come up with some of this. But the fact and the meat is that the next term, you had a basis far more than most anybody I know. Your department had a basis for repair. And it looked like that basis for repair, in my review of what I've seen, and I don't know it all, and I wish I did, is that those things would have been paramount to me to fix immediately, because that is the problem we're discussing here today. Thank you. Thank you, Mr. Chairman.
Thank you, Delegate. And I will just say, I mean, I do think there are things that started to be fixed when you all came in, and appreciate that you have walked us through a lot of them. Obviously, there are new things that were uncovered in this audit. There are some repeat findings, but I think it's, you don't change a culture that is systemically broken overnight. And so I think from the work that we've seen on the Appropriations Committee and some of us on the Budget and Tax Committee, I know you all have been working on these since day one. Maybe not everything, but a lot of the things. And as they came up, and so we appreciate that. Delegate Polakovich-Carr.
Thank you, Mr. Chair, and thank you, Madam Chair, for recognizing me earlier, too. Thank you, Mr. Secretary, and your team for being here. I just wanted to drill down. I have a few questions in regards to the current vacancy rate for caseworkers, and appreciate the progress you've made on that front. But I'm trying to understand, what does an 8% vacancy rate mean in terms of like the workload for a caseworker? Like, how many additional kids are they supporting?
Certainly. So when I was talking about the department vacancy rate, I was trying to illustrate that we went from one could argue one of the worst departments to one of the better ones, only because we drilled down on trying to make sure we could fill every vacant position, and we prioritized very intentionally to the delegate's point about business. We chose to do front-facing customer service positions. So the areas, for example, were child welfare workers or caseworkers, supervisors who had direct line of sight with children and families. Similarly, we did that in 2 other parts of our administrations. We have 3, the Child Support Administration as well as the Family Investment Administration. An example is making sure we filled vacancies to help Marylanders connect to benefits faster. One of the things you've alluded to is around that ratio, and we are literally in the throes of a study that is actually breaking down how many cases per worker and how we're going to use that data in a different way to make sure that we are being equitable about distributing work across all of our workers across the state, and also making sure that we are following best practices nationally. For example, the Child Welfare League of America encourages states to have a thoughtful ratio, so no one caseworker is overloaded with too many cases. So when I was mentioning that vacancy rate, it's to illustrate that it wasn't just within SSA centrally or within all local departments of social services, but across the entire department, again, to trying to turn a culture around that recovering from the COVID pandemic and ultimately really goes to the heart of accountability, because children's lives are at stake.
Okay, thank you. Are caseworkers, supervisory positions, or the child welfare officers subject to the current hiring freeze?
They are not. And we sought exemptions for this exact reason. And most frontline service positions of the 6,000 plus employees of DHS, and my deputy secretary will correct me if I'm wrong, I believe well over 3,000 positions are exempted from the hiring freeze for this exact reason.
Okay, and so were there any positions in this program that were part of the recent employee buyouts?
From the top of my mind, a few. We had just over, I want to say 237 or so that applied. You know what, I don't want to misspeak, we'll follow up with you. Okay. But there probably were a few, and there were longtime employees. But again, when we were actually reviewing, this is important, when we were reviewing an individual who wanted to be part of the buyout, either at our office or with the Department of Budget and Management, we also sought to use an analytical rigor around positions that could be replaced. And why does that matter? Because when we, the department, accept that particular person leaving, that pin goes away. And so we didn't want the pin to go away, and we have been also opening a stronger relationship with our unions around these issues, which had stalled for a while, to be really frank and candid with each other about prioritizing front-facing positions and investing in our people that way. Go ahead.
In addition, Delegate, I think you had asked a specific question about the difference in the number of vacancies and caseworkers. And so translated, our colleagues report that that's 200 more caseworkers than on January 1st, 2023, which, if you were to just do some rough math, is more than 416,000 person hours added.
Okay. Circling back, Mr. Secretary, on your last point, I think it'd be helpful if the committee could get details on those positions
Absolutely.
that where the buyouts
Happy
were
to.
accepted. Okay.
Happy
And then my last question is do you see regional challenges or differences in terms of that vacancy rate across the state?
We have seen, and part of it's around recruitment and retention, for example. We have to, I'll give you an example of something we institutionalized around the practice of how we interviewed grade 19 or above in the state of Maryland. Why? Because we wanted to be deliberate about building a bench of talent across the state and thought about investing in that class of managers and leaders, not just for one single department, but for the entire state of Maryland. The similar logic and rigor was around regionalization. So for example, we were just having a conversation this week about a particular employee left one small county towards the Eastern Shore to get another opportunity a few counties over, but left a vacancy in that other county. And so that director is struggling with that vacancy, but recruiting from the same pool. So we've been trying to be creative with our directors. What other ways can we think about this? Can we approach it much more regionally, for example? What are the right roles that we can be flexible? How do we reimagine the role? So we're trying to use every tool at our disposal to respond to this. And oftentimes in Western Maryland or the Eastern Shore communities is sometimes when we have a little bit more of a struggle, but we also find in some roles greater consistency. So it very much differs on the job itself, but we'd be happy to work on putting some numbers together, the trends that we've seen, at least over the last couple of years, because we actually are tracking them, to better understand how to respond more urgently and to be a better partner to our local departments of social service.
Thank you, Delegate. And actually, I had a couple of questions, and I know, Mr. Secretary, that was something that we had talked about in one of our pre-meetings, that the overall vacancy rate reduction is great. And as Personnel Subcommittee Chair, warms my heart that we're knocking that down, especially in really critical areas. But I had asked, the overall vacancy rate reduction is wonderful, but there were, and I forget which finding it was, there were several local agencies that had it was the finding specifically on the fact that we had not seen the reports updated on abuse cases within a timely manner. And one of the things that was cited was that there were 3 or 4 local agencies that had corrective action plans that specifically called out staffing. And so I'd ask you, great that we have an overall vacancy reduction rate, but are we addressing those vacancies in the places where, especially where the corrective action plans have highlighted a lack of staffing? And so if you have that information now, great. Or if you want to follow up with us on specifically, even vacancy rates broken down by, by local agencies, overlaid, I think, by corrective actions would be particularly helpful.
Certainly, we're happy to follow up with that.
And then I had a couple of other specific questions I just wanted to go through, some of which have been touched on. I did just want to mention, I think, I think you had said we want to be best in the nation on certain things. And so going back to, Delegate Smith's point and and Senator Hedelman's point on the guardianship, the post-guardianship follow-up, I think where there is a nexus where we have a redetermination, if it's annually or every 2 years, where we have that nexus already, we may have to think creatively about once that guardianship is over or is legally mandated and then we move away, how that could be structured. But I think let's be the first in the nation that says we are going to go back and check to make sure that, to Delegate Aarons's point, somebody hasn't changed the status and there's a sex offender in the house or something like that. Like, let's be creative about that. And I think we all stand ready to work with you to give you the legal authority and set up a system that does that. I wanted to ask a couple of just, again, very specific questions. So on the lack of dental and medical appointments, we had talked about, obviously, changing the overall system and making sure that the data is in there. But I had asked you in our pre-meeting, what had happened to, as of 2024, May of 2024, those 690 individuals that hadn't received a medical appointment, and then I think it was 120 who hadn't received the dental. Can I get an assurance that all of those children have now gotten the requisite medical and dental attention that they've needed?
So I want to be clear on the answer in regards to did they get it after the fact. So we went back and we pulled what we would call a milestone report. So we pulled data at the end of May of 2024. Our numbers are a little different than the audit because we pulled the full number of children at that particular time. And one of the things when we started to go in, and I think the secretary mentioned it earlier, one thing we identified is while the exam may not have been in the appropriate medical tab, there in fact was documentation, even for the young people that the auditors reviewed, that the exam had in fact occurred. We also looked at the data as of the point in time and understood that several of the cases for both dental and medical, the case had actually closed. And so if Webb is out of care, I can't go back and say, Webb, let me try to get you a dental visit. It was missed. And so we looked at that and understood that. We also understood that there were several of our young people who are still in care that are over the age of 18, and there were some missed appointments just because they had life things happening, and so the worker is actively working to get it rescheduled. And then there are some situations for that same population over the age of 18 where they refuse to go to said dental exam, medical exam. I might have skipped a yearly physical myself over the last couple of years. And so we're working through that, and the secretary also mentioned that on the dental where we are really seeing a gap, we are trying to figure out how to be creative. We're working with various associations. Several of the teams are trying to figure out, can we do dental buses? Because we just don't have the providers available across the state to actually be able to provide some of those exams. And so the team is drilling in. And I think one of the data points that you heard the secretary mention was, I lost the tape. As of August, we were at 93% for those initial exams. And so we're working to keep that rigor and also ensure that our system is reminding staff that if you got 14 kids, you got to keep up with those appointments. And so we're putting in some extra checks and balances to make sure that those things don't get missed administratively.
I'm glad to hear that. I mean, I was joking with a colleague. I had a conversation with one of our utilities, and they were telling me that they had a system that, you know, if an applicant doesn't send their item in within a week, they get automatic email updates for like a plumbing permit. And the fact that we didn't have an automated system around medical and dental visits for our most vulnerable children, but we have them for a plumbing permit, is just baffling, mind-blowing to me.
We agree.
I know that
We agree.
baffling has been thrown around. So again, just drilling into the audit on finding 7, you know, we've mentioned the trust account piece. Can you assure us that you all have gone back and updated the accounting for all of those trust accounts to make sure that whatever money was supposed to be in there for those children has been appropriately put in there?
So that piece is complicated. So there are 3 children in which were referenced in the audit. And when we go back and the trust account not being done, you have to drill in and understand that a trust account can't be set up if there are limits in regards to their SSI benefits. And so we've gone through to understand the particulars for the particular cases from the audit and have realized that a trust account was not the appropriate vehicle to be set up, because then it would have impacted other benefits that those young people were receiving, which would create a cliff. One of the things we're doing to enhance our procedure and process on special trust accounts, because we are also one of the unique states that has this particular model. We're in the process of finalizing a procurement for a national consultant, and part of the things that we're asking them to do is actually bring in the financial experience and help us learn through the special needs trust. Because once the department sets up said trust, we are actually not the payee, nor are we the trustee. And so our hands are bound on what we're able to do, even with said account, once we've set it up, because of how it is structured. So we're trying to figure out, is this a policy change, or do we need to come back to you as our colleagues to change the way the language is written in statute and in COMAR?
I guess, yeah. I mean, that's good to hear. I guess my fundamental question is essentially, are all the children getting the money that they are owed? Whether it's in a trust account or it's, you know, whatever system needs to be set up, that they have not lost out on really valuable resources that because we didn't do something properly, we being the government. And then just going back to the health piece, I know this is a broader question, not necessarily directly into the audit, but there had been a piece of legislation in 2018 around integrating the Medicaid system and your system. And I wanted to know if you can give us an update on creating that sort of electronic health passport. Where are we with it? What's the process? Are there any things you need from us to help get that finished?
Interestingly enough, Steam did not pick up on this until 2024. And I know that's been said before, but once we learned something, we moved within our authority to get it done. And so there is an active procurement that our Office of Technology is working on with other state partners to actually move that through. But we have begun to develop the business requirements for said system. We've identified the vendor, and we're going through a contract vehicle that will allow us to do a direct purchase versus having to go through the standard 9 to 12 month RFP process. And so our goal is by end of next year, we should have something that is being tested not only amongst our local departments, but this electronic health passport will create portal access for caregivers, guardians, kinship caregivers, as well as medical professionals. And so we'll look to do testing amongst those external stakeholders as well to make sure that once we implement what's been invested, that it's actually usable and will be solving problems across the state.
It's a 2018 bill. Do you know why? I mean, you haven't been here since then, so why it's 7 years?
Sir, I mean, this is an example of, we have been working on the health passport ourselves when we learned about it. I came in 2023, and one of the first things we started to look at was why these things aren't automated. I had not known about the 2018 bill because I wasn't here, but then when the staff briefed me, I'm like, well, this doesn't make any sense. Why is it taking so long? So again, in all honesty, I don't know why it took so long. I can tell you that this team, and particularly under the leadership of Dr. Studstill, has prioritized this. We have lots of work that we continue to work on figuring out. So that, notice he said we try to find other solutions is because we kept running into roadblocks. So trying to find alternative ways to deliver it faster so that every single Department of Social Service, our providers, the entire network, have better access. Alluded to earlier was strengthening the relationship with CRISP. Why? So that we can find other ways to get information. All of those things had not been done. That's the honest answer.
Yeah, I appreciate that. And then I guess the last question that I've got, I want to acknowledge, I think there's at least one reporter from the Banner in the room, and I want to thank them for their reporting. I know Jessica Calafetti is not here, but earlier in October, she wrote a story about the lack of 1080 forms and 2037 forms, which for those of you in the audience who don't know your numbered forms, the 1080 form is for fatalities in child maltreatment, and then obviously the 2037 is sort of the 1080 is the internal form, the 2037 is the form that on those deaths that can then be reported publicly, and obviously those forms are really important because it's sort of the after incident report that allows us to look at best practices, figure out what policies weren't in place, what might have been missed, and I will admit, I wouldn't have known that if it hadn't been for the Banner's reporting, and I think that was really critical. Why we really need good local press. But can you tell me, now that that has been brought to public attention, and I know the folks in Opega are going to dig into that as well, why weren't they being done? What assurances do we have now that they are being done, that they're going to be done going forward? What actions have been taken to hold the local folks accountable? Do we now have a new standard of practice that makes it clear you should be doing these reports and sharing them?
So again, and I can't speak to why they weren't being done. I can speak to what my expectations are as secretary and this executive leadership team, which is that they will be done for every time, unfortunately, there is a fatality, and there is specific guidance in law around responding to the timeline. We have been clear, and the directors who are here know this, we have reminded them of the need for the partnership to hold their teams accountable, because ultimately it goes through a long line of individuals, ultimately before it's captured actually in CJAMs. And I know that that is another example of where there was inconsistency in entering data in CJAMs, because ultimately that's where we go to, whether it's Alger in his role as executive director or myself as a secretary. So the commitment that I will say to you is that yes, they will be done. Yes, we will follow the law. Yes, we will always get them done. That is my expectation as secretary, and the team around me is reminding everyone of that responsibility. Ultimately, I will also say that in partnership with Jessica Calafati at the Banner, all the information that she has been gathering, our team has been intimately involved in, and I very rarely use the word I in role as secretary, but I made the decision for the first time in DHS's history to make a very different level of information available. So if you went to our website right now, you can access publicly available, maybe it's not right now, but there's ways in which you can access publicly available data that we shared with the Banner. And we want to be extraordinarily transparent about these issues while redacting information that at this moment in time we cannot share. So we are committed to being transparent. We are following the law, and we will continue to follow the law on behalf of the Department of Human Services and the Marylanders that we serve.
I appreciate that commitment. I think the committee would love to see what policy practices have changed to make sure. I mean, I know we've had an extensive conversation, not only today, but prior, about the changes that are going to be, in place for a lot of these types of reporting requirements and a lot of the data, because obviously if at the front lines, these things are not being done, you all can't make the adequate decisions and hold people accountable and make the policy changes, and same for us. So I think we're going to put that in the category of we want to follow up on what the procedures have looked like differently to make sure this doesn't continue to happen.
Certainly.
I think I saw Delegate Johnson, and then we'll go to Senator Lamb.
Thank you, Mr. Co-Chairman. I just had a follow-up question. We've talked a lot today about monitoring and the limitations. And so for the monitoring and continued monitoring, is that something you would need legislation for, or could that be addressed through the guardianship agreement?
Yes. We could do both. We could have an administrative addition. Administratively, we could add to the guardianship agreement. We could do that. And we could also consider additional authority, statutory authority. Both options are there, and we could do both. We could do either.
Would the guardianship agreement, would that take care of it without having to go through legislation?
I believe it would.
All right, thank you. Thank you, Mr. Co-Chair.
Thank you, Mr. Co-Chair. Just to pick up on Delegate Johnson's point. So you have, under current existing statute, the ability to do these follow-up reviews of other individuals in that household who are under guardianship, correct? Because it seems like the reading of the statute gives you the authority to do that, that even when I think earlier was referenced that you do annual reviews prior to, payments again. I think as part of that, my understanding is that you do a review at that time. So you have the ability at any point in time, whether that case is closed in the system or not, to go back into that household where that guardianship and that child is residing to be able to do another background check and review, correct?
I believe so, but I want to also circle back to you so that we are clear about aligning the policy, the law, and the practice. And we will, and I believe so is the answer, and we will circle back, just in case I'm wrong, because I'm wrong many times during the day.
And it's fine to circle back and let me know, and let this committee know. But I think what's important to remember and be cognizant about is that, assuming that's correct, and you just said that it was, that this department had the authority to go back to look at it and get that information, run those background checks again. And the department could have done that on its own initiative without requiring additional legislation to do that. Now, this committee may very well look at having additional legislation to mandate that, but you had the authority to go back and do that.
So respectfully, I disagree that we have the authority. I'm happy to look more closely at it. We have the authority and the obligation to do the criminal history checks up to and through the point where legal guardianship is transferred by a court to a family through guardianship or adoption. We have that obligation up to that point, and we do. The difference is after the legal guardianship is transferred, what can we do? We can condition guardianship assistance payments. We can do that. But is it in Family Law 551 that says after a guardianship is established and a court has changed the legal obligations of the parent and the agency, you can go and do these criminal history checks? It does not say that. And it doesn't say we're required to do it. But if you want to look and see if you have a different interpretation, I'm happy to have a conversation about it.
Sure, happy to have that conversation. I mean, I think looking at some parts of COMAR here, which, I can cite, but I don't think folks know the statute right offhand in the audience. But, there is nothing that precludes you from going back to do that. And so, it's clear from the authorities here in COMAR that you have the ability to go back and review these when there's annual reconsiderations. It does, at that point, say that, that allows for suspensions and terminations for ineligibility, right? So that's all, there's nothing in there that forbids you from doing that.
So this is an example of an area that we are actively exploring right now, Senator. And based on our interpretation of that part of COMAR, we respectfully disagree with the way it's being interpreted right now. And I think that rather than, I'd rather circle back with you and the committee about how we are interpreting that section, specifically because it does involve the action of a court. And we have been repeating this. We are happy to work with you if you want to consider other options. But as of right now, and again, as of right now, we do not believe that we have the statutory authority that you are citing right now at that piece of COMAR. Again, we will work with you to figure out a solution moving forward.
But you believe you should do that. The department should do these follow-up checks. Whether, this by statute, if we're going to require it through legislation that's passed later this or next year, you believe that the department does have a responsibility to these children to do these follow-up guardianship checks.
We do believe.
It's the right thing to do.
Right. And so, yes, and we will figure out the way in which to do that constitutionally.
Okay. In your comments to the committee, you noted that that you now have done 100% of the background checks for licensed providers, but it doesn't seem to note anything about unlicensed providers, like folks who are doing the one-on-ones, which was a concern of this audit. Is that something we should be doing as well?
Ultimately, yes. And when I mentioned very specifically moving to a statewide standardized contract system, that is the expectation.
Okay. There was this, I guess, landscape analysis that was done earlier of the department. And, I guess my concern, and this dovetails behind what the chair said earlier with regards to vacancy rates, that, vacancy rates is an interesting metric because it just tells you which positions are still unfilled, but it doesn't tell you whether you're staffed at the proper amount, which is a concern. So if you're only following vacancy rates, to the chairman's point, I think that falls short of what we actually want to know, which is, are the pins in the right place? And do you have sufficient number of pins, not just whether those pins are filled?
Certainly.
Now, with regards to this, this is your landscape analysis, and number 5 says operational capacity within the system must be strengthened for statewide youth outcomes to improve. There are a lot of, concerning, I guess this is feedback from the local DSS staff and directors. And just to summarize them, to quote one, we are a fear-based organization. What stood out yesterday was that some people in the state office had no clue about how the work they do impacts us and the kids. Another quote, policy development does not involve input from the field, so it isn't able to address unique local concerns or bring locals into uniformity. And quote, there has not been leadership at the state to promote compliance and accountability with policies. So there seems to be a gap with morale when it comes to the local DSS directors and staff. And it's hard to implement these policies and have that level of accountability if there isn't that level of trust between central SSA and LDSSs. And so what can you do to improve that? And what have you done to improve that in the year since this year or two, since this has come out?
So I think, Senator, you're referencing the assessment that we asked for around actually trying to end the practice of aging out of care. Is that what you're referencing? Okay, great. So number 1, we asked for it. And to be very specific, it was a priority as secretary I came in on because I had looked at the data when I was being interviewed for the role of secretary. And so one of the things we did was we wanted to ask for honest engagement with our young people. Many of those quotes, we actually went across the state. We actually sat down in partnership with national foundations and had really candid conversations about the state of which they were experiencing our department. We did not filter any of that, which is why that's in your hands right now. I've personally, and this team has circulated that assessment. And in that, we have been very deliberate. Out of that exact assessment and those conversations, not only did I, but many of the people here and in the audience sat with these young people and asked, how can we be more thoughtful and responsive and respectful to what you need? That was the origin of our Family Matters work, which I referenced. The Family Matters work was directly connected to trying to modernize kinship law because many of the kids also told us that we weren't doing as much as we could to find their families. Another example of something very specific that was related to this, for most, at least for the last couple of years, we stumbled across the fact that finding family was done manually at the local level, when in fact we could use modern technology. We actually, in the last couple of months, approved a contract that we took to the Board of Public Works that will, for the first time ever, modernize family finding and using modern technological tools, not only help our caseworkers, which will improve morale, where they're not doing things by hand manually and actually can reach out to multiple people, not only in the state of Maryland, but across the country. So that assessment was what we asked for, the results of which we have intentionally lifted up. We created a Family Matters practice, started looking and doing case analysis in partnership with our local departments of social services. Just in terms of morale, we just launched the first ever set of Family Matters Awards to honor teams across the state for remarkably turning around. And one of the awards we gave, for example, was to Tiffany Rexroad and her entire leadership team at Washington County. They had the single largest increase in a positive way for actually placing children with kin, and it had extraordinary results. And they helped deliver the 260 children in Maryland which are now living with kin by blood or by choice that we didn't have in place. We didn't have a modernized law in place a year ago, and we had no changes in policy and practice. So in all of those efforts, including, because it took me a second to realize what you were reading from, we asked for that, and we have intentionally moved with urgency to make sure we not only build morale, but listen to the kids, and that's where this work came from.
And I appreciate that response. I think, if we're still hearing complaints, probably as recently as a few weeks ago, about morale and challenges with trust when it comes to the SSA in the central office and our local DSS folks. And I think that is concerning because if we were to do a confidential questionnaire now about how workers at DSS, local DSSs feel, they would probably you probably still see some of the same points that were brought up here.
Add to your point and address some of the things you mentioned. So your first question was around the workload. So we are actively doing the workload assessment at the caseworker level with the vendor to help us understand, aside from a caseload standard, you could have 12 kids, but those 12 kids could feel like 50. So this workload assessment does in fact engage all of the 24 local departments. So we have all of the staff signed up to do random moment time sampling so that we can understand where are they spending majority of their time. And then from that assessment, there'll be recommendations that we'll be able to determine internally and possibly with our General Assembly partners, how we might be able to do that. One of the other pieces you mentioned was around the relationship. And that's true. And I could speak to when I arrived, there was a breakdown in communication and collaboration between central office and the local departments. So some of the things that we've done, at least in the last 20 months to rectify that, is we now have a child welfare policy network group and an adult services policy network group. Both of those groups are comprised of staff from all of the local levels at various management levels. And it also includes young people with lived experience. It includes parents and caregivers with lived experience, as well as advocates, to make sure that as we develop policy, it's not just from one lens, it's not just from one vantage point, but that we're actually bringing the people who these policies will impact to the table. So that's something that we've done that's very real. And within SSA, we have 114 positions and we do still have vacancies. Some of those vacancies, because of things that we've learned over time, I, in fact, have terminated some people because of actions and what they were doing. And so we are building a new era of child welfare, not just at the local level, but even at the central office level, to ensure that we have key staffing, and we brought on new positions. We reinstituted old positions that had been cut using internal resources so that we can have an SSA of 114 people that's able to support field staff of over 2,000 as well as over 3,000 young people to make sure that even though we're a small and nimble team, that we are responsive. The work doesn't end at 5 p.m. I get calls from directors after hours. I call providers after hours. So we're changing that philosophy as well as that mental model to ensure that we are being responsive as central office to our local departments. And there's still room to improve.
Last question, just switching gears real quick. So former Delegate Valentino Smith and I had passed legislation back in 2022 for reporting on child placements. And it's clear that some of this information from these reports are actually reporting on when the initial kind of look at on how these children are being placed is being recorded, not on them actually being placed. Is that something that you can correct? Is that something you can address? Because I think that's not the intent of how we passed that legislation several years ago.
Agreed, Senator, and actually I'm gonna have my Assistant Secretary on Policy address this.
As to the report specifically, we said this yesterday, happy to have this conversation. Let me understand a little bit better what your intention is, and we can make sure that the report reflects what the intention is. I think we can do better. I think we can report more clearly.
Okay, because I'm happy to work with you on that because I think that would at least get to the spirit of what we're trying to capture in that data. And I think what we're getting is not aligned with that.
Fair.
We agree.
Okay, thank you.
Thank you. I want to follow up on the question of data. And Mr. Secretary, earlier in response to my colleague and his pointing out about some of the information included in the banner, you talked about your commitment to transparency and that information was available. There used to be a data dashboard on the website that contained information about Child Protective Services and foster care, foster homes, family preservation, et cetera. And I just spent a little time on the website and it says it's under maintenance. And I think it has been for some time. Can you tell us when to expect that kind of data transparency to reappear?
Certainly. Again, owning that had never happened, we created a team to build it. We just are in the midst of finalizing a new chief data officer. We have an acting data officer, and what they've been furiously working on is updating those dashboards. I believe by early January they'll be back up because we found we wanted to make sure that there were deficiencies in what we were putting out publicly, and that was the reason we pulled them down to do some maintenance work on it. So again, very transparently, we had nothing like that before. We rapidly prototype an idea to look at all of our administrations, not just the Social Services Administration, but Child Support Administration and the Family Investment Administration, and those will come back up very shortly.
And my understanding is that those existed and were updated monthly for many, many years. So I hope we can come back to that kind of.
So, ma'am, to my knowledge, there was nothing that we saw when we got there that was on the website, or there was not a data office that had any of those. So there may be other things that might have been on the website previously that I'm personally unaware of or we're unaware of, but we created these from scratch in deep partnership with our local departments of social services. And so that was, again, not only the spirit of transparency, trying something new, because we oftentimes get questions from nonprofit organizations or advocates or lawyers, and we were trying to think about how best to capture that, again, all in the spirit of transparency. So that's, and we learned a lot. We got an earful about what wasn't working well with those dashboards, and I think there's PTSD across this table and behind me about what we learned, literally in the spirit of trying to do something new and different. So we are with you. We will get them back up. I didn't want to cite an exact day because sometimes I'm wrong, but I know it's imminent because we took that feedback from the community across the state, and I think when we're back up, they'll be better. And we will welcome feedback and criticism to strengthen them.
That's good to hear, because I don't think that we want the community to have to rely on a PIA to get this kind of information.
Agreed.
All right. I don't think there are any other questions, so we thank you very much for being here and answering our questions in your presentation.
Thank you.
That is the conclusion of the Joint Audit and Evaluation Committee today. Thank you.